by working together.
Hello, everyone, and
we
welcome
meet
to Let's Connect 2024. My name is Shada Harrison, and I am your MC for today. It's a pleasure to be here. Good morning. Nice and early, 9 a.m. Managed to make it. Very good. I can see you got your coffee over there. Okay, well, it's very cozy in this space, and I'm loving it. The focus of this year's Let's Connect is to activate arts for well-being. We have a packed lineup of speakers, we have case studies, and we also have a panel discussion. So yes, it will be very packed, and we only have one break. So it's very important that you know where the toilets are, okay? Our session today is followed by a networking lunch at Tipo. And, obviously to make most of this networking lunch and to really enhance it, also while enjoying the makan, we have prepared some prompts by Michael Tan and Jonathan Tang. Now, to access these prompts, you can refer to your handout that you would have received upon registration. Now, I had a look at these prompts. I really, really love them. They are questions such as, who do you want to connect with today and why? And the second one I really love is, what are you curious about today? Now, we're experiencing some delays, so we're going to have our first part of our networking session activity outside today with Jonathan Tang that I'm going to invite over. Thank you, Jonathan.
Hi, thank you. Hi, welcome. Suddenly got thrown to do this, so so welcome. So my name is Jonathan Tang. I'm also JT. If you want to, it's easier to remember, like just the Asian Justin Timberlake. That's perfectly fine. So when you came in, you probably received this. So you can take maybe a few minutes just to look through, and these prompts will help in terms of guiding conversation or really connecting, making intentional conversations with people while you're having a break, while you're having tea, some delicious food. I took a peek just now, or even during lunch. So there's one side which is, as you have mentioned, like what brings you here, what are you curious about, what do you hope to achieve, who do you wish to connect with, and why? And then on the back page, there's also other things of like, to what extent has the arts been considered in your sector or in your organization? And really, that helps to maybe narrow down people that you want to identify and connect with, or even just like-minded people, or you have a project in mind and you're looking for an artist. So this is a perfect place to find artists, because most of us here, I believe, are artists. And also, as you walk around, there's some flip charts outside. So that's also other prompts for you to think about. There's a lot of writing involved, but we are artists. So if you do not want to write, you can draw, you can dance, record yourself, send it to me. I will share it with people. But really just connect, and that's the point of the networking. So maybe take this 5-10 minutes just to take some time to respond to these prompts before we begin the rest of today's session. Thank you very much.
Hello, hello. So I hear a lot of chatter, a lot of connections made. Very nice. Now, we are going to start off again, but before I begin, I'd like to make you aware of the speech-to-text, which is happening right behind me. Now, for those of you who would like to access the speech-to-text interpretation document on Google Docs application, you can scan the QR code that is being projected on the screens. Please note that the live speech-to-text interpretation conveys meaning for meaning information, and it might not be word for word, though we aim to convey the same information as the live speech. And as I said, there's only one break today, so you really might want to know where the toilets are. There are toilets to my right past the registration booth, and there are toilets downstairs. But if you do get lost, which is very possible, please go outside and, talk to anyone with a black T-shirt, and also NIC staff and representatives. Okay, well, to kick off Let's Connect 2024, it is my honor to please warmly invite the CEO of the National Arts Council, Mr. Low Eng Teong, to welcome us with his opening address. Please, Mr. Low.
Is this okay? Yeah, can you hear me? Yeah, that's good. Hi, distinguished speakers and friends, very good morning. And it's such a pleasure to be here this morning with all of you at this year's Let's Connect. And I again warmly welcome all of you to today's session. Now, as you know, Let's Connect is an annual event that NAC organized that brings together a diverse group of people from arts organizations, social services agencies, educational institutions, healthcare organizations, government agencies, businesses, and arts freelancers to come together, share, and connect with one another. And I think you already started early this morning at the breakfast. Now, the theme for this edition is Activating Arts for Wellbeing. Activating Arts for Wellbeing. I think it's a topic that's very close to many of you here. This is to reflect the growing recognition of how arts engagement can improve individual and community well-being in viable and meaningful ways. Now, building on the themes of the past two editions of Let's Connect, and some of you may have attended the last two editions, today's discussion focuses on what the role of the arts within the healthcare sector could look like. And we want to encourage all of you here representing the various sectors to consider how we can create synergy between the arts and healthcare and work towards greater collaboration between the two. Now, to kick off the discussion, this year's presentation will begin from the macro perspective, giving us a big picture of trends, to various presentations on how arts practitioners have responded and can respond to the needs of our community. Now, very pleased to have with us to kick off the sharing, is starting with Ms. Tamsin Greulich-Smith, who will share on healthcare transformation critical to meeting the demands of our aging population. And you know, aging population is actually quite a significant trend in many countries around the world. Following her presentation will be Mr. Michael Tan, who will speak about the local developments in the sector, which is gaining good momentum. And Ms. Lee Sze-Chin will share on how individual arts practitioners can come forth and contribute in this area. Now, why is this area of work important to us and our society? At the National Arts Council, we believe that the arts can inspire society, inspire people, spark creativity, and connect us better to the world. Our efforts to embed the arts within healthcare responds to the national and worldwide shift towards understanding health and well-being more holistically, and to consider how the arts can play a role in enhancing the quality of life for people from all walks of life and at all their different life stages. Actually, what I'm speaking and what all of you will be talking about here today is really much about a deep and more engaging relationship with the arts that we all want to foster. I know many of you here, and I believe that, would have had personally experienced at some level the transformative effects and power of the arts. Personally, for me, sketching in my journal is really one of the ways that I've been using for many years to unwind and recharge from the stresses of life. But it's not something that I will exhibit, for now at least. However, many people will still feel that the arts is not for them. They are either not very interested or they find it very inaccessible. And most of them may find it easier and more convenient to just maybe, watch network TVs and go online surfing, sometimes just to take your mind off. I'm quite sure we all do that from time to time, right? Just keep flicking the rest TikTok just to take our mind off. If only we could bring the nexus of arts and well-being to more people, help them discover how participating in the arts can enrich their lives and bring about greater connectedness with their lived experiences. I think that would be wonderful. There are already many examples of such integration of the arts and well-being in various collaborative efforts between the two sectors. You will hear from 3 specific organizations later. First, ArtsWok Collaborative will share on how arts allow people to dwell meaningfully and engage more deeply into very difficult topics such as end-of-life issues. The TENG Company will share on how music for mindfulness can be delivered in an accessible and engaging manner. And the Esplanade will share how movement can help foster intergenerational bonding. Now, we know that delivering impactful interventions requires deep research and like-minded partners and collaborators. On NAC's part, we are partnering with SingHealth Community Hospital, an agency for integrated care, to build deeper understanding and to build evidence on the impact of the arts on well-being. Together with healthcare professionals, artists, and researchers, we will study how arts programs can be better designed to promote well-being and in healthcare and community settings. The result from the study will then support greater advocacy for the use of the arts as prescription. We hope to share some of these best practices, impact measurement tools, and case studies stemming from this partnership in future edition of Let's Connect. So I'm actually committing to that. We'll have more of this session in future. But for today, I'm pleased to share that NAC will be launching a resource, which is the Arts for Community Building, a program design toolkit. And this toolkit outlines the process for designing programs to bring communities together and strengthen community bonds. The toolkit distills learnings from the various arts projects that we have commissioned over the years. We hope this will be a useful resource to guide anyone who is keen on conceptualizing and designing such programs that can really contribute to impactful and positive change. I hope more of you will find out from this toolkit at the NEC booth later. Now, my colleagues and I always look forward to Convince Let's Connect because it is a time for learning, reflection, and I think most importantly, generating good conversations and making meaningful connections. I hope all of you would be able to stay for the networking lunch beyond after all the presentations. I hope over the good food and drinks that we are providing, you will be able to take the conversation further into future collaborations. Now we once again, warmly welcome you to the session, and I thank you for spending time here with us this morning, and I hope that all of you will have a very enriching and fruitful day today. Thank you.
Thank you, thank you. Wow, Mr. Low, I always feel inspired by all your welcoming addresses. I really am looking forward to your exhibition on sketches, though I hope that happens. Now, I think we're all ready for our first speaker. She is none other than Tamsin Greulich-Smith. Tamsin is Director of School of X at Design Singapore Council, building human-centered design skills whilst tackling social challenges. She is also a faculty member at the National Centre for Healthcare Innovation. Let us put our hands together for Tamsin as she presents her talk entitled Painting a Healthier Horizon. A round of applause, please.
Thank you so much. I have to say, in the grand history of being introduced, this is the only time my name has been perfectly pronounced. A big round of applause. Thank you, thank you. Thank you so much, and good morning, everyone. It's such a joy to be here, and it's sold out, right? I had so many colleagues saying, oh, we really wanted to come, but the tickets are sold out. So count yourselves so lucky to be here. And I hope that I can live up to the expectation of the honor of opening today. Bear with me as I try to present this macro scale picture of health, where it's come from, where it's going, and the role I hope we can all play. This is a topic that's super close to my heart. I've worked in the impact space all of my career with a particular focus on how we can use human-centered design and creativity to improve social or health impacts. I'm being told to speak more slowly. Improving impacts for people through creativity and design. This thing's never going to keep up with my pace and accent. I apologize now. Okay, let's go. I want to start by looking back in time, and I'm probably one of the older people in the audience, and I always make the joke, I know I don't look old, but I really am. I'm now in the category in Singapore where I'm considered old. Great, thanks for that. But I don't feel it, and this is the thing about aging, huh? We don't feel old necessarily, but sometimes our body doesn't make us believe that our mind is correct. I remember when healthcare was different and when we diseased differently, and it has changed. Anyone recognize that? It's interactive, you can shout out. What's this building? Oh, yes, someone knew, SGH, I live nearby. So Singapore General Hospital. And back in the day, when the hospitals around the world were being built, our healthcare needs were quite different. We used to be treated for single episodes of care. So you might go in with a broken arm, and that broken arm would be fixed, and then you would go home. Or you might have a disease that couldn't be fixed, and so therefore they made you as comfortable as they could until you sadly passed away. But it was a single episode, and it was quite easy for us to put people in a hospital ward and fix them up. And also in these days, perhaps because healthcare couldn't save us so much, we maybe were a bit more interested in taking a bit more care of our own health. We didn't have people running away from the vaccines as much as we did during COVID, okay? Just saying, a controversial opening, because we were worried. Actually, this thing might save me because I don't believe that the healthcare or the medicine can necessarily save me. So that I'll come back onto this in a minute, but there's a part of this in terms of mindset and self-ownership of care. Fast forward to today, and things are quite different, and we know this, and we've really heard in the opening address. We are in an aging population. Congratulations, Singapore. It's phenomenal to be in this position. We are living longer than ever. The expectation is that babies born today could live to over 100 years quite comfortably. 120 years, yeah? So that's a very different lifespan to my parents' generation and my grandparents' generation. And we'll come on to why that's a problem, but as we know, as we get older, I don't expect you to read all those words, but they're depressing. Because as we get older, pretty much everything starts to fail. When I teach design, I often talk about the fact, I do exercises, and I compare the adult approach to creativity to the toddler approach. Wow, toddlers are so creative. They see possibilities in everything. And as we get older, our creativity declines. Yeah, but it's something we can work on. But unfortunately, lots of things decline as we get older. We become more frail. Our innards don't work so well. Our organs don't work so well. We're more likely to need glasses. And this, even if we feel healthy and fit, it means we probably need to look after ourselves better as we age. And if we carry on living the lifestyles we did when we were 20 or 30, we're heading towards more problems. So as we age, we of course attract more problems. We can see that as we age, chronic conditions increase. Yeah? We're more likely to develop a condition, a chronic condition, which is something long-term, quite likely to last you the rest of your life. As some depressing doctors, do we have many doctors in the room today? Medical doctors? Not many? Wow, that's a gap in the audience. Next year, right? As we age, we're more likely to develop a chronic condition. And the depressing news is that once you have one chronic condition, you are more likely to attract others, like a magnet. So as we age, we start developing more lifelong diseases that slowly, progressively get worse. I'm starting depressing, don't worry, I'll lift you by the end, right? And things like cancer. Cancer remains the leading cause of death in Singapore. I really am depressing you actually now, huh? The good news in all of this is fewer people are dying from cancer than they used to, so that is encouraging. But actually, these are just blue for red and blue for men and red for women, right? But actually, what we can see is the incident rates are increasing. So more of us are developing cancers, but thankfully, more of us are surviving them. And that's partly thanks to the advancement in medical technologies. We can do genome sequencing more easily than ever, which means that your specialist clinician can really look at you in terms of your genetics, Your specialist can look at your lifestyle and connect genetics to lifestyle. Your specialist oncologist can look at the type of cancer you have at a cellular and molecular level and link that to your genetic code and link that to your lifestyle factors and create an incredible diagnosis and care plan that helps keep you alive. That's incredible, right? We are very, very smart. Even this is from Lund University in Sweden. I thought quite cool. I'm fascinated by nanotechnology, right? I can imagine that at some point we no longer need to go to the dentist because we have little nanobots in our toothpaste that fix cavities before they appear. That would be cool, huh? Could be possible. But at the moment, what is genuinely happening is there is technology that allows nanobots to go into our body and cause the cancer cells to self-destruct. Whoa, mind-blowing. It's not scaled yet, but nonetheless, the possibilities are quite fascinating. And bear with me for 1 minute while I share a quick video of other things that are already taking hold in healthcare.
Hi, everybody. Hi, Sophie. So the HoloLens itself really allows us to reshape the way we connect people, we communicate with people, and also to be used in teaching and training. Initially, when you put the HoloLens on, it feels a bit strange, but actually within a few minutes, it becomes quite normal. You feel as though you're just discussing cases with people in the same room, for example, like we do in normal hospital practice.
We can come in and actually look at this content in full 3D. And obviously when you're working in this case, the medical field, having a full 3D understanding of a situation, for example, is really much more powerful in solidifying how you want to navigate it in your mind.
The pace of change is remarkable. Technology is really shaping and changing the way we provide healthcare very quickly.
Wow, you see? Did you know that was happening? Augmented reality, and it's not that new actually. They've been developing this technology for more than 10 years in the surgical theatre so that they can really have a better understanding of how to treat the surgery. If things go wrong, they can draw in experts from around the world. So you could be here operated on in Singapore with a specialist in America joining that surgical procedure. So quite astounding in terms of what is possible. So wow, well done healthcare, well done medicine. We are advancing at an unprecedented rate. So as fast as the human being and the human body is throwing challenges at healthcare, technology is advancing, medical science is advancing so that we can treat people. We're responding really well. But the question is, although healthcare is undoubtedly playing a huge role in keeping us alive for longer, what's the cost? Oh, anyone had burger lately? I must admit I did. My son loves them. And it's just really a symbol of the lifestyles we're choosing to live. If you remember earlier, I shared that healthcare didn't used to be able to keep us alive so well. And so maybe we took a bit more ownership of our health. I studied at Imperial College in London, and one of my favorite lectures was around, or my favorite topics was around risk. And I remember really being struck, back when I actually was young, by my professor who talked about risk. And when seat belts were first introduced and legislated in the UK, and he said the interesting thing that happened was that car accident rates increased. So suddenly we brought seat belts in to protect people, and we started crashing our cars more. Human psychology, right? Oh, I'm safe now, I'm going to drive like a lunatic. Now, the good news was the intervention saved lives dramatically. Seatbelts do save lives, so please wear your seatbelts. But because we trusted in the seatbelt, we stopped taking so much ownership of our own care. We started driving a bit more erratically because we thought, it doesn't matter, I'm wearing my suit of armor. And in some ways, we see this reflected in the attitudes we have to our own health in other areas. Healthcare can save me. Do I really need to wear sunscreen? Do I really need to worry about smoking? Do I really need to worry about my diet? Yeah, because what I know is healthcare can fix me. And as a result, it places burdens on the healthcare system. We're seeing even in ultra-slim Singapore, where incidentally, in my first year living here, some lovely auntie came up to me and she went, you, quite pretty but fat. And I was like, oh my goodness, in the UK I'm considered quite slim. No, fat, eat less. Wow, okay, great advice. I'm now used to the blunt opinions I am receiving. But the sad truth is, it's changing. Our obesity rates are increasing because healthcare can save me, right? Do I really need to worry about exercising? Do I really need to worry about the level of sugar in my diet? And sadly, yeah, we do. We estimate that 1 million people in Singapore will have diabetes by 2050. Okay, this is scary. We've been officially waging a war on diabetes for years now, but we're not making much headway. Stop eating sugar, everyone. But we're not taking ownership of this because we've outsourced our health to healthcare. And this is placing a huge burden on the healthcare system. When you bring together the aging population, and as I've mentioned, as we get older, we need more healthcare support. We're more likely to attract chronic conditions and multiply them. We're placing more of a burden on the healthcare system. This is a photo of one of our emergency departments in Singapore. It was a temporary tent they had to put up outside because they couldn't cope with the demand. What has happened? The answer is not in building more hospitals, okay? We now, because we're being treated for multiple conditions, have to see multiple specialists. And when you go in to see your specialist for one of your chronic conditions, that specialist will focus on that chronic condition, and the others he'll leave to another specialist. So you're going around multiple specialists and multiple care teams to be treated for your multiple conditions. It's a nightmare for you, the patient, and it's very burdensome on the healthcare system. And sadly, we do focus on health rather than well-being. We still see well-being as a nice to have, yeah, yoga on the beach when you've got time. We don't see that well-being and health are intrinsically linked, that actually when we focus on our well-being, our health benefits. We don't see the interconnection, although we know it's there and the science is there. Suicide rates in seniors are increasing. Sorry, I really am bringing you down today, huh? It's a horrible and sad truth. We are functionally keeping people alive longer, but the well-being isn't being addressed. 60% increase in senior suicides for the age group 70 to 79 in 2022. These are seniors giving up on life even though they're being kept alive. So something in the equation is not working. And then we have to think that as we get older and we develop more chronic conditions, we need more help. We will probably end up losing or giving up our own jobs, and then maybe even asking our loved ones to give up their jobs so they can care for us. And for a caregiver, that is exhausting and demoralizing work. And we know that a lot is done to support caregivers, but this is an additional burden on the healthcare system. Should we give up now? No, we're all here to save the day. Welcome to the new frontier. I just thought that would be a nice dramatic headline. Let's go to the happy ending, huh? Wonderfully, wonderfully, and I've been talking about this for a lot. For the past 10 years in Singapore, I previously ran something called the Smart Health Leadership Center at NUS, where we really looked at how we can transform health outcomes using design, digital, and data. And the design part always came first because it was about understanding human beings, their motivations, their emotions, their needs, and then bringing all these other solutions to help achieve different outcomes. And it was about taking a holistic lens. So Healthier SG, that was officially launched last year, hooray for it. It takes a new approach to our health. It looks beyond healthcare, it looks beyond clinical treatment, and it says we need to understand the social determinants of health. We need to understand how to prevent ill health before it begins. We need to understand how to help people live and stay well to reduce the burdens on the healthcare system so that healthcare time and resources are freed up for those who really need it. So Healthier SG, hooray, thank you everyone for seeing it. There are multiple things we are doing in our communities. We're looking at how we can provide more care services, preventative care services, right in the heart of communities. So it's easier than ever for you to be reminded about and to access services that can prevent you from falling ill. We can pick up on illnesses before they take hold. You can find out that you're pre-diabetic at a stage when you can still prevent the onset of diabetes. So we're doing a lot more to really try to stop people falling ill in the first place. And when they do fall ill and need healthcare treatment, then when they return to the community, there is support to help them stay well. So this is a phenomenal shift. We're also doing more to activate communities that care. So not just putting services into the community, but bringing us together. And that's why I love the theme of this event, Let's Connect. Let's connect to improve the health of all of us, because that really takes us back to the Kampong spirit, which this is a photo from up in Lee Sze-Chin Health, where I've spent several years working. They have the Wellness Kampong, where they bring community together. And it's not all about explicitly telling them this is good for your health. It's about building good health through the roots, through social connectivity, and that's so critical for our health, through access to nutritious food, making it easier for people to access food. We still have people in Singapore needing to be given access to fresh food, which is so important for them. Group activities, so all these things that bring us together nicely. And wonderfully, and this really is a great opportunity for all of us in the room, seeing more of a focus on resources that can help the individual, so a more person-centric approach. Social prescribing has been very well established in the UK, which is where I'm from, for many years. So the UK really took the lead on this. Partly, I have to say, to reduce the burden on their healthcare system. The National Health Service in the UK is really overburdened. So social prescribing was one of the measures they took to try to alleviate that burden, because if you look at the number there, 1 in 5 people visit a GP for things that are not actually clinically related, There are other ways of addressing that. My son in the UK was part of this system. He was a personal fitness trainer, actually providing fitness plans for people on prescription rather than medication. So it's a much healthier and more sustainable way of living, but it's really designed around that individual. What's going to resonate with you? Who are you? It takes the GP to understand you as a person, what will resonate with you and what will help meet your care outcomes, rather than saying, there's one clinical prescription for your condition, and that's what I'm going to give you. So it brings me on to my final chapter. What role can we play? And there's much that we can do. The wonderful thing is, art, design, creativity is no longer being seen as the fluffy nice to have. And I say that with a little bit of bitterness, because I train people in how to use design and creative problem solving to achieve different outcomes in complex challenges in the real world. And I'm often described by people as doing fluffy work. Oh, it boils my blood. So anyway, I'm just saying, there is evidence that creativity produces tangible care outcomes that matter. And the World Health Organization has published its results on that. So anyone tells you you're doing fluffy work, redirect them. We see now in the UK, more than 40 studies were done to directly link the engagement of the arts with care outcomes, and I believe we'll hear more about that today. In America too, they're trying to understand more about that and really embed that, and there are many initiatives taking place. And of course, we know also in Singapore, and I'm going to come on to that in just a moment, we have tools, there are toolkits available to help you understand the role that the arts can play as a prescribing tool. But what I'm really excited and delighted about, and so grateful to be part of the conversations at some point, is the partnership that we've heard about earlier between the National Arts Council, Singapore General Hospital, and the Agency for Integrated Care. Wonderful. I'm so excited to see what happens there, because we will bring tangibility to the role of the arts in health and well-being and in transforming care outcomes. And that doesn't mean we should lose sight of the value we individually gain from art. It's not about saying let's commodify it. It's about helping those that don't yet see it to see its value. I don't know how many of you saw this. Thank you, Lynette. I saw this through your LinkedIn post last year, earlier this year. It really touched me, and I think we may hear more about it later. A beautiful, beautiful initiative that the National Arts Council was involved in, A Night to Remember, which took people with dementia and through dance engaged them in a very powerful way. And it touched me personally because during the pandemic, my father-in-law passed away. He had dementia, and social isolation had a dreadful impact on his health. He lasted only about 1 month into lockdown before, sadly, his condition deteriorated so badly that he passed away. And you would think, how can that happen? But in terms of dementia, the engagement makes a massive difference to the way that people can live and the quality of life they can live. And the sad second piece of resonance is that my own mother was in the UK for 2 years. I couldn't see her during COVID. She was on her own for 2 years. 2 years living on your own four walls, and she thought she was fine, but sadly she emerged from the pandemic extremely frail and with dementia. And she had to go into a nursing home earlier this year, which was really quite a sad moment. But I went down, I flew straight over to see her and help settle her and to help her to see that this is a different life for you. You're no longer living independently in your own home, but look, you're surrounded by people. And we sat in the lounge. I'm a bit of a troublemaker. We sat in the lounge and I put MTV on in the lounge with all the old seniors sitting there staring at the walls. And I was like, whoa, Mum, look at this. And we started singing along. And before I knew it, some song came on that in the 1980s we used to dance around to. My mum suddenly got up. Bear in mind, she'd been frail. She got up and she started dancing and saying, woo, Tam, I love this. And I thought, this gave me so much joy and gave her joy. And we may not be able to measure the health outcome of that, but in every other way, the power of that was incredible. Yeah, it helped her feel I can survive here. It helped her see there was a new chapter. And this, to me, is actually about saying, as we age, we treat aging as a depressing thing, don't we? Oh, everything's failing. Actually, it's just about a wonderful new chapter, and I firmly believe the arts is the way of unleashing that new chapter and reframing it as a positive new experience in life. Rather than seeing it being a downhill one, it's just a wonderful new chapter that we go through. So thank you for creating this beautiful video. For School of X, we've been delighted to be involved with many projects on a care basis. It's one of our largest areas of work. How do we bring people together to use a creative problem-solving approach that allows us to achieve shared change, changes that we want? The Wellness Festival, actually we're so delighted, began in a School of X workshop. We have participants in the room from NAC, and we're delighted to have been involved with all of the editions of the Wellness Festival so far. This is really about building a Singapore-wide movement to embrace wellness, and that's really the next chapter. How do we start to recognize the role of wellness in health, and then, therefore, the relevance of arts and creativity in achieving it? I want to just end with a short video, which I hope explains why we need a more human-centered approach in the future and the role that we can all play. I've watched that video hundreds of times, and every time it gets me in the back of my throat. And the reason I share it is not to end on a depressing note again, but to say the thing that links us is that we're all human and we're all living multiple stories. And the one-hat-fits-all clinical approach that fixed a disease rather than healed a person, actually, the time has come to move on from that, and that is what we're seeing here in Singapore. So I want you to remember that health is about people, not about clinical treatments, and the chance for all of us to play a role is now. I'm ending with a dreadful image. This is also to give you hope, okay? We hear a lot lately that the arts will be replaced by generative AI, and this is living proof that's not the case. I prompted generative AI tool to say, create an image for me of a healthy, happy Singapore. This is the best it could come up with. Truthfully, it's the best of a bad bunch. Our jobs are safe, everyone. In fact, we have multiple jobs to do. Please take away from today that we play a more vital role than ever. Thank you to National Arts Council for really putting health and arts on the agenda together and proving the impact we can have. And thank you for allowing me to start today's discussion. It's been my pleasure. Thank you.
Thank you so much, Tamsin. Wow. Moving on now, our next presentation is entitled Rethinking Systems and Deepening Cross-Sectoral Relationships by Michael Tan, who is the Dean of Research at the University of the Arts Singapore under NAFA-UAS, and he is also a creative health practitioner and researcher. His talk poses these questions. What might be causing inertia and what needs activation? Mr. Tan.
I'm mindful of line of sight, so I'm just going to move the table. Hello, everybody. Very good morning. I'm Michael. I just want to get a sensing of who's in the room. Maybe you can just raise your hand up. I think it helps us to identify who are the people from different sectors. So who are the colleagues from arts and cultural heritage sector? Can you put up your hands? Okay, from social care and healthcare? Great. Education? Right, so check out who these people are. It's useful for your networking. So I would like to first begin by thanking the organizer. It's a privilege to be here to share with people my thinking around, arts and health, and also about the broader system of how we make it work. So what I'm trying to do today is to impart some handles, some conceptual handles, as we talk about arts, as we talk about health, what is it? So a question to the audience. What makes us well, and why the arts? If we actually think about how health emerges, where it comes from, do we exactly need to go to a hospital? So that's my first question. And where are the places that health actually takes place? Does it actually take place when we interact with each other? Does it happen when we actually cook? Does it happen when we are with people? Or maybe making art. So this is a question of where, what, in terms of what kind of art form, where can this happen in terms of, health and arts, as well as how can we actually make this happen. So I'm going to start by unpacking health a little bit, just to build on Tamsin's introduction. I think we are very used to, the definition of health as something that is physical. If we are not feeling well, feeling a bit feverish, I'm ill, right? But I think if we know the general, broader kind of definitions provided by WHO that talks about health as, a multidimensional that spans from physical, social, mental, right? That, I think, is sort of like a status quo. But of course, over time, through research, through thinking and reflection, there are various different models that are out there that we can actually look at. So my question, another question, I've got lots of questions. But this is an invitation for us to think about as contributors from different sectors who are interested to partake in these conversations around health, arts and well-being, community. What are we actually doing? What is it based on? What are the handles that we can actually think about? So I'm just sort of like fleshing out some handles here. If you just do a quick search on models of health, you'll find lots of it on Google. Google is your friend, right? So check that out. But I think it's important and it is a useful handle for us to think about in the work that we do, in the practice that we pursue, what is actually that model of health that we believe in and what are the dimensions that we are aware of. This would be helpful for us to talk to each other when I'm sort of like looking at what dance can do, right? I'm actually looking at maybe the physical aspect of dance, or I'm actually looking at, you know, the more social aspect of dance, and this will help us to communicate with each other. So think about that model. And I think this is another provocation that I would like to put forth, because I think when we talk about health, it is largely situated from a biomedical kind of lens whereby, you know, I mean, that's the authority of healthcare. I'm a bit provocative in that sense. But this is the kind of understanding that I've gained from my own practice as an artist, especially when I was working on a project in a nursing home. The nursing home has got a certain kind of system. It has got a certain kind of construct with people. But when an artist goes into that space, momentarily that space changes. So for us who have been working with community, we notice that kind of change. So through that experience and reflection about what this process meant, and of course because of my study and whatnot, this idea of thinking health as a situated circumstance rather than something that is sort of like emerging from oneself, right? It's actually interdependent on a lot of things beside our own physical body system, right? It's reliant on the people that is around us. It's reliant on the resources that are available to us, and also the environment that we live in. So as we think about health, I think it might be useful for us to think about health in a relational kind of manner whereby it is dynamic, right? And it is actually shaped and it is capable of changing and shifting based on different entities that links from the material, the people, the thinking. So it is not just one element, but I think as we talk about health, it is useful for us to think about that because these combinations of elements that I'll call them does affect subjective health well-being in a positive way and as a negative way. So I think it's useful to think about, you know, as we talk about health, what are the things, what are the elements or factors that are actually attributing to this? So building on my own work and thinking around what I'm doing, and also my own reflection of, you know, what it means when we talk about arts and health, actually one of the questions that I posed to the organizer is, what is it that we are actually activating as we talk about activating arts for well-being, right? So in my current work, I'm sharing with you the socio-ecological model of health, which is a different model of thinking about how health actually emerges and how health is actually created in society, right? I think, and this is where we are sort of like even thinking about, you know, relations between system and ownerships, right? In terms of who are the gatekeepers of health, which I'll raise up later on. But I think if we do think about the ecological model, it really draws out the importance of thinking about the individual and how that spans into interrelation, interpersonal, to community, to society, and then institutions, and then policymaking. So in order for general health and well-being to be achieved in society, we are all stakeholders. We are all players. So this then opens up that question of, then where does the art sit? So think about the socio-ecological model. And I think within this, there are things that we can actually unpack. I think, you know, in the work that we do, as we think about the relation between arts and the connection between arts and society or community, notion of determinant of health, right, is useful, I feel, where we actually use that to think about how individual resources from socioeconomic, from financial, political factors, they all play a role, which is why it is important for us to connect. It is why it's important for us to have dialogues, to really understand, and I hope this will give us some context. And I think in the midst of doing this, while we are also reflecting on the kind of disparity, I think there's always this we are mindful of the big narrative as a society, aging population, right, or mental health. I think in the work that we do, there are also spaces, there are in-between spaces that also invite us to scrutinize and to think, because we have to take ownership in what we believe in, and I think that is what will push us in the work, right? So in your own practice, in your own networking, I think it's useful for us to kind of like think about where the disparities are as we talk about health, well-being, and the arts and opportunities. I think in the process of doing this, as stakeholders, we are also trying to redistribute the power. And when I talk about power, it's really about who then gets the budget and why, where does the budget of the arts actually flow as we talk about healthcare, right? So I think this is multiple layers. It is a very complex kind of conversation, but I think when the ground is aligned, when the ground is starting to speak a certain kind of common language, it helps us to relate what we are finding, what we are noticing, to bubble up in policy making. So, which is why the ecological model is interesting to me, because it really illustrates the interconnectedness and the interrelatedness of that. So, over here, this is my question, right? What are the structural and systemic factors contributing to health disparity and inequities or equities as we talk about, the relation between individual to policy? And then this is where we come in, right? Where and how do the art fits? And I think maybe now is a good point for me, because I forgot, right? To talk about what the arts means. So there are studies that are out there. Colleagues in the field internationally have been unpacking what we mean by the arts. So another way to think about it is when we talk about the arts in this context, arts is participation, art is engagement. There are two ways to look at this. There is modes and form. Modes will refer to the way we engage with the arts or participate in the arts. This will involve receptive, which could be just enjoying a concert, or it could be active, which is about making. And then the form itself relates to the different kinds of practices, right, that we could look in, from visual arts to dance to literary art, All right, so that's how we could actually look at the arts. And I think one thing that is quite interesting here that I want to kind of like draw out is also when we talk about the arts in this context, it is also useful to sort of like think about the various dimensions that the arts could present, because I'm mindful of this narratives about the art as a form of treatment. But I think moving on, I think we can be more expansive about how we think about the arts in terms of how the arts can be protective, how the arts can be preventive, how the arts can be educational, how the arts can also be developmental in terms of my self-development. So I think in this conversation, in this context, as we are discussing what we are activating and what the arts is for in community for well-being, I think let's just be mindful of the various dimensions. The exciting thing here is Singapore is doing the right thing. So Joanne and I and our team, we have actually done this study on a paper that is out there. Later on, you can scan on the QR code. But this sort of like give you a very broad overview of what is happening in Singapore. So our study was based from 2000 onwards. And what we have illustrated is, generally when we talk about arts and health, it's a multidisciplinary field, and we are advocating for this kind of practice, this kind of thinking, promoting practice, encouraging research, and promoting excellence. And from there, you can see, the different art forms, the different modes. If you go to the paper, you'll see more. I'm just mindful of time. I've got a slide. So I'll flash the QR code later on. It's there. So as we talk about arts well-being and activating it, scholars like colleagues in the UK have been working on it, including myself. We've been thinking about like what makes the art tick, right? Tick. So Daisy and colleagues have came out with this study. That's because Daisy's background is in public health, so she's an epidemiologist. But from her work, because of her interest in the arts, she talked about active ingredients, which is from the field of psychology. So this is a model that has came up context, people, and project. So what they recognize is as we talk about activating arts in community, there is actually a pipeline of consideration that we could think about, right? From the context, recognizing the environment where the arts is taking place, to the people in terms of who we are sort of like working with, and also the outcome of the project, right? In terms of the attributes within the arts, in terms of the stimulation that could go on. This paper is free, it's on welcome resource, so have a look at this if this is helpful. But what I think is important here is to think about the kind of active ingredient in the different kind of art forms as we are trying to connect with community. What is it that we are activating? So I hope this paper itself will actually give us some handle. And unfortunately, as I was preparing this just a couple of days ago, Daisy and Katie came out with another new framework. So if you Google Radiance framework, it's out there, fresh, July 2024, and it's open access. So feel free to look at it. They listed, building on this model, 37 sort of like active ingredients from a meso, micro kind of level. So if you're interested, if you're a geek in this kind of information, go look out for that. So coming back into Singapore, so we have identified that, where we are today with this event itself, it is actually a concerted effort by different stakeholders. And this is also built based on the understanding that we are able to kind of like huddle together and have conversation, and this contextualization of what health is, how the art plays a role in it, has been useful to move us into this. And you can see some of the main domains include population aging, lower community costs, which is what Tamsin was talking about in terms of the burden on community health services. And then integration of health and social care, which is a lot of mobility there with work by AIC. As well as the more recent issue around mental health. So the QR code will give you the access to the paper, and it is free. So while preparing for this, I had an analogy that popped up to mind. I think we are very familiar with this in terms of the blind man and the elephant. We have got different stakeholders. All of us are interested in health. So we close our eyes and then we mong cha cha, go and touch. But I think this is what this occasion is for, whereby we are trying to articulate, we are trying to unpack, we're trying to understand. As we are coming together to promote health and well-being, how do we play a part? And I think what this is illustrating too is the notion of an ecology, right? Which then begs me to think about, okay, I'm going to move to this first. So it begs us to actually to think about the ecosystem of health and care, right? So it raises the question of who can be involved as we talk about health, as we talk about care. And I think coming back to it is really about where does the art fit and what could we actually contribute, right? As we come into this ecosystem, how can we actually reimagine a new system out from this? Is it just healthcare that can take care of health and care? What about the arts, especially as we are talking about activating arts for well-being? All right, so I think what is important here is also that I hope I will have time, I have 5 more minutes to raise, but it is really building on the socio-ecological model, and it comes back into storytelling, it comes back into narratives. We are the outcome of our own narrative. Our organization is also an outcome of the narrative that the organizations sing. So it's rather provocative, it's rather disruptive, but I think this is where critical thinking around health, arts, community, society, people comes into play, right? So this is an invitation for us to think about, what kind of stories, system stories, we are system, the workplace is a system. So what kind of system stories and archetypes are proliferating within system that we are in or within ourselves? So maybe this is a checkpoint for us, even as administrators, as educators, as we come into this event, as we are interested to talk about health and well-being and the arts. What does it actually mean, and what is that story that I'm trying to say? So I will quickly sort of like just highlight this because we come from different systems, and the system relies on different feedback kind of loop. I'm going to talk about reinforcing loop just for the sake of time. So a reinforcing loop is actually a mechanism that will causes the sort of like the outcome to reinforce itself. right? So I think in our own sort of like workspace, whether you are a community service provider or you're an art education institution or you are art administrator, I think every day as an encounter, it is an opportunity for us to evaluate and assess what is this story that we are telling ourselves and what is this feedback that we're actually giving to our stakeholders, because whatever feedback that we give to that stakeholders, it will actually route itself back. And I see a lot of that kind of tension as we are trying to even out the relation between, you know, the arts and the social care sector. And I think that's also another space where we need to kind of like look into. So I think I still have some time. So what I think is important here is for us to just be mindful of, you know, when we talk about system, the way to go about assessing system would be actually to think about perception, the perception that we have about the system, which is coming from intention, beliefs, and the value. What is actually our goal? What is actually our expectation? The kind of demand, the needs, right? The pressure, the kind of resource, and the results. So these are the things in sort of like a casual feedback loop that reinforces the system, and it needs someone like myself, maybe, to disrupt that system to really get us to think where we are going. And I was speaking to Tamsin this morning, and she was just sharing that, yeah, we need thinking time, and a lot of time we underestimate, especially when we are running organization. We don't stop and think where we are going, and I think that is part of the barrier. So it's really about, if we are to challenge this system thinking, how could we actually make that shift? So these are some of the prompts that I've sort of like came out building on that system thinking. I'm more than happy to share the slides with you. So I have 1 minute. Okay, so opportunity spotting, right? So as we talk about activating arts, why we're activating arts, where we can go, there is that grand narrative, and I also want to invite you to think about where are the in-between spaces, because those are really opportunities. So I'm currently working on the WHO Lancet project, so building on some of the work that Tamsin has spoken about in terms of the non-communicable diseases, the burden of it on society. So this work sort of like built on, you know, the current narrative of our WHO Westpac, where they are also spotlighting on non-communicable disease, which are cancer, cardiovascular, respiratory, diabetes, and mental ill health, right? So it's that kind of streamlining, and I think through this work, we are able to make some recommendation to WHO. So it's still a work in progress, where we are also posturing what the arts can actually do in terms of NCD. So if there's anything that you want to look in between, I would maybe encourage you, like beside the grand narratives, pick up some lists from the NCD's list and think about, is that a space for you? I'm not saying that it's a one thing fit all, but do think about that. There's also increasing work around mental health. So PM Wong, sorry, I'm updating myself. I just came back to Singapore. So PM Wong kind of like came out with a national policy around mental health. So what does it mean? Where art can connect? And I think this is where we come back into the various aspects, right? Art is known, you know, in health and well-being to be used for treatment. But I do believe there's also opportunity as we talk about all these different health conditions in terms of the communicative, the educational, the developmental, right, the protective and preventative. And we have to rethink about the system that we have now and to really think about how education and stakeholders, as well as, you know, colleagues in the field, could actually come together and huddle. And I think there's a lot spoken about social prescribing. So this is something that's quite interesting. So if you are interested in that, do connect with the community of practice. And I think these are, I'm not saying that these are the things that we need to do, but these are some of my observations in terms of what is bubbling up or what has bubbled up in Singapore that is useful for us to look at. I have a list of references out there, and if you want to get in touch with me, feel free to just scan my QR code. And do I still have time? Okay. Thank you.
Thank you so much, Michael. Wow, wow, wow. You've really jogged my brain awake with all your questions. It's fantastic. And you know, towards the end of Tamsin's talk, I was very emotional. I mean, you really brought us back to the human-centeredness, and Michael picked up on that. You know, I think two things, health and well-being, are really intrinsically connected, and the interconnected relationships in healthcare from ground up to policy making, that potential, the ecosystem of health and care, and how can we imagine these current systems. Thank you so much for all of that. I'm so awake now and alive and inspired. And I'm sure all of you are too. I can really feel all of you taking notes and jotting, especially the woman behind me. She's like taking as many notes as she can. Well done, A star. So thank you very much, Michael. All right, I'd like to introduce our next speaker is Lee Sze-Chin. Sze-Chin is an artist, educator, and art therapist. He holds a Master of Arts in Art Therapy from the School of Art Institute of Chicago, USA, and a BA in Fine Art from Goldsmiths University of London, UK. His talk today is entitled Arts for Health and Wellbeing. Mr. Sze-Chin, please.
Can you all hear me? Yeah, that's good. Okay, yeah, I was trying to figure out how I hold all these things together. Okay, yeah, so I think we've maybe heard perspectives from Tamsin, okay, more of from a macro point of view, and then we kind of, I think that was the idea, to kind of like slowly move downwards, more to a micro point of view. So my presentation today, I'm going to be talking about maybe ground-up development from a practice perspective. So I know that in the original blurb about this particular talk, I was going to kind of talk about maybe different approaches from practitioners, but I will talk a bit about that later on, and also like maybe think about it maybe more from an inward-looking lens. Okay, so now, as we look at the arts, okay, the arts give physiological benefit, right? They normalize the healthcare environment. Okay, they create empowerment. They produce positive feelings. They facilitate meaning through expression, build cultural awareness, engage people in community. So I think we saw a lot of examples of that, okay, especially when Tamsin was showing some of these videos, right? And they offer tools also for practitioner self-care, right? Bucciarelli talks about this, okay, and I think, you know, the arts are a powerful partner in health, okay, and well-being, and offer this unique blend of therapeutic, expressive, and community building benefits, right? So I think when I had the chance to kind of think about this and reflect about this, I spent maybe about the last month kind of looking through, walking through, okay, and so this is, and I love the feeling of walking through a museum, through a gallery or corridor space, and discovering new things, right? And so these are, I feel that these are spaces that are full of adventures, and this is the Jurong Health Campus corridor, okay, and so I was walking through, and then I spent the last month kind of like talking to other practitioners, trying to find out a bit more about maybe what are some of the challenges that they faced, right? I kind of tried to distill that, because I was thinking, you know, how should I present this, right? When I was kind of tasked with kind of presenting this topic, right? So I thought that I would try to distill it into like maybe some words that we can kind of look at, and then after that I will turn the journey more inwardly into my to the work and the collaborations that I've done with different partners, with different stakeholders. Okay, so I think in this particular arena, I think a lot of times we are thinking of like the gig economy. So a lot of artists in arts and health, a lot of us are freelancers, right? And we work with organizations. And I think one of the difficulties, one of the challenges that are faced is kind of like trying to find and secure consistent work, right? And and of course, I think a lot of times things like project funding also impacts, okay, the continuity of some of these projects, right? I think when we think about underutilized potential, you know, I think Michael talked about this idea of like what are our goals and what are our expectations, right? And I think that's something that we can think about in terms of like what are the artists' goals when they come and work in an arts and health environment, and what are maybe some of the organizations' key performance indicators, right? Do they prioritize maybe, for example, novelty over sustained impact? Okay, so I think, you know, when we think about this underutilized potential, I think there's, when I talk to practitioners, they talked about like how they would have liked to have more of a conversation, okay, about the how organizations evaluate the success of these arts projects. And of course, I've seen projects where I think we work hand in hand, the artists and the partner organizations, they work hand in hand to kind of develop these outcomes, right? To measure some of these outcomes, and those are some of the things which they work together in collaboration. And I think when that happens, okay, we can kind of see how we can kind of look at perhaps how they can maybe consider perhaps broader potential of the arts beyond exhibitions and end products. Okay, and I think one of the maybe underutilized potential that I talked about with some of these artist practitioners were kind of like the role of the arts in emotional management, perhaps the role of the arts even in change management. Right, so for example, I think the STAR program at the National Gallery, okay, that talks about maybe, that focuses on emotional awareness and resilience program through art, okay, where participants use art for personal exploration and growth. So, you know, it's not just really focusing on an artistic outcome, okay, but also then focusing on what the participants can get out of this in terms of their personal growth. Okay, so, so I think with that kind of challenge put out there, I thought then I would kind of turn that lens onto myself to kind of maybe talk about some of the projects that I've done, to maybe give you some visuals of what some of these projects might look like. Okay, and for a lot of our partners over here, I think that would be maybe something to consider, right? So, so I think this is an image that I did in a recent exhibition called Big Big Small Small, when a group of art therapists, 10 of us, we were exploring the idea of the big and small things in our lives that were inspired by the patients that we worked with. So then this was one of the images that I generated through conversations with AI to kind of think about that journey of finding structure. So I thought maybe that was kind of useful as an image to kind of start this inward-looking journey. Okay. And I think from a ground-up kind of perspective, I think what are some of the opportunities that are available? Okay, I think a lot of times, you know, some of these projects we are looking at working with very diverse demographics, right? So you know, we kind of tailor some of these works to meet some of these specific needs of the different demographics. Again, some of these collaborative projects involve artists, healthcare professionals, and also community members. Right, so one example that I have of this was the nursing home arts residency project that I was a part of. Okay, this was in 2018. Okay, and it was organized. It was a joint initiative by AIC, Agency for Integrated Care, and National Arts Council, and it culminated in this wellness exhibition. Right, and it was showcased basically the works that we did together with nursing home residents, I think over 100 of them, from about 100 nursing home residents, and we created these projects, in which then I think we also did like a toolkit for it. Okay, and these were the two that I did with my co-facilitator Karen. Okay, and the middle one talks about like expressive weaving with yarn, and then the right one talks about creative storytelling with digital photography, right? So I think what's interesting about this particular residency, as I kind of reflected on it, was maybe kind of how it struck that balance between well-being and some of the artistic goals, right? And basically, I think in a lot of the conversations, we were trying to map out a program that the participants with a diverse range of artistic abilities could enjoy. Right. I think the other part about this in terms of from a grounds up perspective is kind of like thinking about what the artist brings to the picture, right? I think maybe thinking about the unique perspectives and maybe the skills that they can bring to health and well-being initiatives, right? So I thought I would share some of these projects that I've done where I've started, and this is maybe also from a personal interest in art and tech. So I've kind of worked with different collaborators, and this particular work was me working with Moses, a fellow artist, and where we led participants on a virtual stroll through a kampong that we recreated. That was modeled after Kampong Buangkok. Okay, that's the last existing kampong in Singapore. So we kind of brought participants to see what kampong life was like in Singapore through VR, and we shared it via Zoom. And so I'll show like a short clip of it just to kind of let you have some visuals of it.
就介绍一下，这就是我们的钢板。This is our kampong. As I move slowly, so you can take a look first. Welcome, right? 这个钢板呢 ，this kampong is called Kampong Ubi Kayu. 这个钢板叫 Kampong Ubi Kayu. 你们知道什么是 Ubi Kayu 哦？Do you know? Have you stayed in a kampong before? 你有住过钢板吗？
有谁住过钢板？举手一下。哇，有好几个，是大家差不多大家了，好，都住过钢板。
哇，你们的钢板跟这个钢板差不多哈，一样吗？
Is it similar? Yeah.
So I didn't record, but the participants were actually responding to us as we were doing this via Zoom.
介绍一下我们的钢板哈 So I just very quickly introduce you to my kampong. And the first thing is I want to introduce this tree that is in front of me. 钢板的声音要听一下哈 Must listen to the sound of the kampong lah. Okay, I pick up the stick. I'll try to hit it. Hope I'm more successful than just now. Wow, not very good still. Still cannot. Not bad. Okay. 我的红毛丹已经在地上了。来，我们去捡一下哈，我们去捡一下。Let's go nearer and try to pick up the rambutan.
Rambutan trees has been growing around our kampong for some time, and then as a kid we used to go and climb this rambutan tree and pluck the fruit from it, and we have it for our dessert in the afternoon and also in the morning. Whenever we feel like it, we'll go to the rambutan tree and pluck those rambutan tree and take it. And we used to be chased after by the owner of the rambutan tree. Of course, around there are some other trees like guava, banana trees. It is around the kampong too.
Yeah, so my rambutan doesn't look too bad, huh? I wonder what's your favorite fruit? 你最喜欢什么水果？
Okay, so so that was one of the works in which I think we were kind of exploring this idea of, I think we were really looking at the audience that we were working with, and these were like seniors, right? And then so kind of like thinking about how we would engage them in a bit of like reminiscence therapy. And so then from there, I think that was how we developed this particular virtual tour for them. And I think this was in the context of COVID. So we were doing this while kind of like engaging the participants through Zoom. The other project that I wanted to share in terms of looking at leveraging the artistic lens, right, in terms of unique perspectives, is kind of looking at, again, from my perspective, how a group of artists and myself, okay, we formed this artist collective called Chronoscapes, and how we thought about how to bring some of these art and tech initiatives over to the community. Right, so this was initially, I think, a pilot with Arts in Your Neighborhood, with National Arts Council. But then since then, I think we've kind of looked at activating this particular artwork in like different community spaces. So like void decks, we have gone to the National Library and also to N parks as well, the parks. So I'll just play a short clip just to give you a sense of like what happens during these community sessions. Okay, so I think, you know, I think what I shared with, I mean, looks like really nice aesthetic pieces, right? But I think in recent times, in some of my projects, I've really been thinking about like, how do I go beyond exhibitions? How do I kind of refine some of these outcomes? I mean, of course, in terms of a lot of art-based intervention, we can think about alternative ways of thinking, measuring the outcomes, right? We can think about qualitative feedback, we can think about long-term well-being indicators. But I was also quite intrigued by the processes that are involved, right? So this particular one was a project that I did with Jurong Health, okay, and it was called Portraits, Small Things That Matter. And actually, recently, just Tuesday, okay, I was actually visiting the exhibition, Giving Back, Celebrating Our Life Stories by the artist Joanne Yoong. It's on show now at the National Gallery. She worked with elders from St. Luke's Elder Care Senior Care Center. I don't have the photos here, but I thought, you know, what was interesting was there was actually a section that documented their journey from week 1 to week 8 of her working with the seniors. And I thought it really reminded me of the beauty of the process, right? And how that journey of discovery and how that kind of relates to the next few images that I'm going to share, where I think the process is just as important as, or maybe even more important than the end product. You know, the conversations where I listened to when I was working with the seniors on this particular project, right? So this project, actually, I was asking the seniors to think about their, what are maybe some of their small pockets of happiness, right? And then to kind of get them to draw on some of these memories, and then to create, then we utilize AI to help them create some of these memories of their cherished moments. Right? I think what was interesting about this project was how it supported participants to kind of overcome some of the challenges of a medical setting, and also like also helping to overcome their cognitive and physical constraints. Right? I think more importantly, the next few images I'm going to show through, I think as we look, you probably see that the AI generated images are like picture perfect, right? But I'd like us to consider how we can strike that balance by kind of considering the small things that matter. Right, so this was a drawing by Mr. Mahfuz, okay, just one session that I had with him, but where he kind of imagined a happy time where he was as a young boy kind of swimming in the kampong. And so this was the image that he did on like a paper coaster, which I still hold I hold very deeply in my heart, also because Mr. Mahfuz actually just passed on Monday. Yeah, just this Monday. But I think when we kind of generated the AI, you know, we kind of came up with images like that, right? But I think for me, really what resonated with me a lot were really these conversations that we had through the initial drawings that we did with the patients. Okay, and this was a drawing by Madam Pang, okay, another participant. And this one, actually, I did like it was over a series of sessions, right? And then she kind of talked about like how she was kind of thinking of home, she was longing for home. So she kind of expressed those wishes, which then, we generated the AI, okay? And then we were able to kind of like relate this to her family members. And then also work with, also like inform the team about like some of this longing, so that then I think, it's kind of captured in the system, okay? And so I think when we kind of think about some of these outcomes, right, I think it's really thinking about finding the balance of what you want to showcase. And this relates to the idea of looking beyond exhibitions and refining some outcomes, right? So I think from kind of like a ground-up kind of perspective, really thinking for art practitioners, I think, it's really thinking about how we activate ourselves, right? And I think it's important to embrace the role of the arts practitioner as a change maker, okay? And in terms of seeking opportunity, and I think it sounds like what we do in a job search, but I think, it's important to connect with organizations that are focused on arts and health, okay? And to explore artist residencies, workshops, or collaborative projects within these arts and health settings, right? In terms of developing skills, I think it's important to kind of like seek out professional opportunities in therapeutic arts, okay, and to learn about specific needs and challenges, okay, and to continually refine that artistic practice to meet the unique demands of the field. So I actually have this image, okay, from a book chapter, okay, and it talks about like the different skill sets, okay, that practitioners in arts and health could kind of like develop. And I think, even from my own background, when I eventually came into this field of arts and health, it was also from fine art training, and then kind of like I actually went into nursing, then went into art therapy, and then like took out courses in counseling. So that kind of like is that layers, the different layers in terms of developing skills. Right? And I think importantly, it's really to think about how we kind of advocate for the work that we do, and to kind of think about the awareness or maybe of the value of process-oriented approaches that prioritize participant engagement and experience. Right? I know I am actually running out of time, okay, but I'm just going to talk very briefly about in terms of thinking about the ecosystem in terms of partner organizations, right? So I think it's important to kind of think about having that clear and open communication between artists and the partner organizations, just as we talked about, what is your goal and what is your expectation, right? So I think, one possibility is really thinking about some of these process-oriented approaches that prioritize engagement and experience, and then also activating this artistic lens, right? So I'm just going to leave you, okay? So I think what I wanted to mention over here was this idea of curiosity, and how I think of it as an important ingredient in kind of activating the arts for health, right? Because I think when we are curious, then we are in a favorable position to communicate, okay, to learn, to understand, and to collaborate. So I leave you with this image of some of the silly things that I do, okay, to kind of like explore and explore art and tech, and to kind of then, think about new ideas. Okay, yeah. Thanks.
Thank you so much, Sze-Chin. Wow, so many questions, so many thoughts. The role of the arts in emotional management and change management, the balance between well-being and artistic goals, art and tech. Who liked that Ubi Kampong? Did you? I really love that one. I really want to go there. So thank you so much. Another round of applause for Sze-Chin. Artists as change makers. So we've had three fantastic talks, a wonderful welcoming address. It is time for us to take a short break. Now you can please make your way outside for some refreshments. And if you'd like to take a moment to unwind away from the crowd, there is a space behind me that's been set up. It's an experience by Music for Mindfulness by the TENG Company. All right, so if you'd like to go back there, there's some bean bags, and it's going to be a lovely experience. Also, after the break, there'll be a panel discussion, and there'll be opportunities for Q&A, which will be live, old school style, where we'll actually give you the mic and you answer the question. Now, I'll prep you for that later, teach you all how to do question and answer again. Also, we have a quick announcement. We've got 14 slots available for the slow excursion, and you can sign up for the slow excursion outside at the registration booth. Also, we have some yummy pies full of white sugar that Tamsin told us not to eat. Some focaccia bread also available for breakfast. Enjoy your break, and we'll see you back here very soon. Thank you. Ladies and gentlemen, welcome back from your break. Now, we've had a morning of compelling presentations. It is time now for a panel discussion. As mentioned, we have a question and answer section. So, when you ask a question, we'll go through this. You raise your hand, we'll come to you with a mic. And before you ask the question, it would be helpful if you could introduce yourself. That will make it all very clear for us. And also to keep your questions concise. All right, well, our panel discussion for today is titled Charting a Way Forward. What next? It is with great pleasure that we invite back again, a second time for Let's Connect, to introduce Joanne Yoong, who will lead our panel discussion for today. A little bit about Joanne before we invite her on. Joanne is an applied microeconomist and interdisciplinary researcher working on consumer and household decision-making in vulnerable populations. Dr. Yoong holds multiple faculty appointments and is the author of over 102 peer-reviewed articles in leading economics, medical, and public health journals. She is also the founder of Research for Impact, a local social and behavioral science think tank. If that isn't impressive, wow, it's amazing. Please give her a round of applause.
Hi, thank you so much, Sharda. That's nobody likes me anymore after this. Thank you for inviting me here today. I'm an economist. I apologize in advance. But in my defense, I am a behavioral economist. So economists, we used to want to pretend to be mathematicians, and now we pretend to be psychologists. It works a little bit like that. I wanted to, first of all, thank you again for the opportunity for listening to three such incredible speakers. I will preface a little bit my remarks with where I'm coming from today. I think what we've heard from our three incredible speakers today are firstly about the value of the arts, that the arts have a very direct and immediate benefit on our health. As a behavioral economist, what we know is that the arts creates a sense of well-being directly. It stimulates that part of the brain that allows us, a little bit like Inside Out too, to think about our core memories. And that brings for us, again as a behavioral economist, a way of thinking about preferences and value and quality of life that actually transcends what we do today in our everyday prosaic works of living. It also acts as a very strong enabler. What it does, in addition to also being a very direct link to well-being, it helps us to take on other interventions, including health and social connectedness. It helps the medicine go down. When a very famous health economist once said, drugs, surprisingly, don't work in patients that don't take them. But what we know is that, again, from behavioral science, that there are three things that motivate people to change behavior: capability, opportunity, and motivation. And I think what we've heard from our three speakers is that, first of all, arts opens up new ways for us to think about capability. It opens new types of capability for us to access well-being and health. It opens up ways for us to reframe and gain new sense of our own capability. So that's amazing. It compensates sometimes for our physical capability. It creates new opportunity, and I think we've heard that again from our third speaker. It opens up, and our second speaker, it opens up at all different levels of the healthcare and community systems that we live in, new opportunities to engage in completely new ways, both physically, socially, digitally. I really like Kampung so much. I'm from Malaysia, guys, but now I'm from Singapore. Thank you very much. Please don't send me home. But most of all, what the arts does is it highlights the third missing piece of this motivation. And it does two things, motivation we have, automatic motivation and reflective motivation. So again, it's a very direct trigger for automatic motivation. We feel things and we do things, and those of you who, again, are in this area and really we work every day with the basic material of human emotion, it galvanizes us in ways that are beyond reflection. But it also opens up space for that reflection. And it helps us to think better. Right? So in all of these ways, the arts are so important for us, and they bring very direct value to us. And I'm going to be asking some questions later on, because again, the other side of the world that I have to live in is when we have to take that value and put a dollar number on it. Right? And I will argue also that one of the questions that we have here about next steps is how do we better articulate this value to ourselves, for our practitioners, and for the policymakers, who at the end of the day want to understand sometimes return on investment. If they're very nice policymakers, they'll say social return on investment. Right? But how do we speak that language? That's why I'm here, I think. I do cost-benefit analysis. Right. So we want to talk a little bit about this. I think Tamsin has given us some food for thought in saying that this conversation needs to be more human-centric and very design-oriented. In a world where we are all convergent thinkers, it needs to help us be divergent thinkers to open up opportunities. I think Michael has told us, and again, thank you, Michael, for being such a prolific co-author. 11 out of 10 will collaborate again, right? Michael has, I think, argued very much for both a more precise way of speaking about it, but also a broader scope of how we think about it and speak about it. And I think finally, Sze-Chin has come back to, I think, brought us back to the fact that whatever it is, this conversation needs to be about practice, and it needs to be practical. These are two things that are very critical for us. So again, the conversation, I think, that has been very multidimensional. I will also just end off, I think, by saying that one of the things that struck me very deeply is that my father is a palliative care physician in Malaysia. And he's worked in palliative care and end of life for many, 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 many years. And part of that is that, he has a sing-song in the community. People sing Hokkien songs. But Hokkien songs in particular, even if you're not Hokkien, bring out something that is very, very key, which is why the kampong really resonate with me. Unfortunately, my dad has ALS. And so for the last year or so, he has been going downhill a little bit. And one of the things my father said is that, after all of these years of being an expert, he has never really understood what it was to be a patient. And the other thing which we have been sort of thinking about as he has, we've had little sort of things where he's lost his ability to write and now he's a bit losing his ability to speak, is how can we help him to speak? And one of those things has been exploring, my father writes journal articles and then he makes me edit them like I don't have a full-time job. Because let me tell you, you can be 50, but you still don't have a full-time job for your parents. He writes journal articles, but he understands that that's not the way that he wants to communicate those last messages. And we are also exploring this both as a means of how we support him in his journey and what he does going on in the future. And so for us, the arts has been very meaningful. And I would also say that one of the things, again, I'm a researcher. I've written, if someone says you've written more than 102 papers, that means you have 103 papers. It doesn't really mean you have 200 plus papers. But the thing I think that apart from all of the New England Journal of Medicine papers and the Lancet papers and the WHO papers, the thing that really helped me to understand caregiver burden was Claire Wong and Nolina Muhammad's performance of, Recalling Mother by Checkpoint Theatre, which they do just to sort of say a little bit about it, every few years, hopefully, they do again capturing the relationships that they have with their mothers at that time. And so it walks the journey of Claire and Nolina with their mothers through early adulthood, what it means to be a young woman, and then after through dementia, and then eventually through loss. And that experience for me taught me much more immediately about caregiving and what that journey would look like prospectively than any economics paper. Again, I still do cost-benefit analysis. Please call me. But I think it's been a tremendous conversation, and I really appreciate having this conversation here today to think again about value and how we open those conversations. And with that, I'd like to invite our panelists back on stage. So before I open up to the floor, because economists, we're also very bossy, Before I open up the floor, I'd actually really like to take the time to go back to each of our panelists to maybe speak about something that actually really resonated with myself as we went on, and that I'd like to hear a little bit more about. And I think just speaking of around each of the particular talks. So I thought if it would be possible, again, thank you, Tamsin, for that eye-opening look at the Singapore healthcare system. It was great to go back in time. I would really like to hear about the work that you actually do facilitating those conversations. How do you take that design thinking process on the ground to healthcare professionals to help them think about the arts? What happens in that box?
Thanks, Joanne. And what a gorgeous opening. Thank you for that. The thing that I do that is extremely unpopular, that makes me a lot of enemies, but really drives change, is I refuse to use a template or a framework. Okay, I'm going to offend lots of people now. I'm always asked, what's the framework we'll be working through? Because we're a wonderful nation. I'm not Singaporean. I've lived here for 12 years. I feel Singaporean. I feel every National Day, I'm the one crying. Yeah, where all my colleagues saying, hey, long weekend, I'm going. I'm like, no, I'm staying. When I see that helicopter in the sky with the flag, I'm like, oh, Singapore, I'm so proud of you. I'm so proud of Singapore, right? I advocate for Singapore overseas. But there's also a transition point. What got us here isn't going to get us where we need to go next. And that mindset for being very good at engineering solutions, very focused, very solution-focused was wonderful. It lifted us to where we are now at the front. Incredible. Well done, Singapore. And now we're there saying, oh, what next? And the framework can't be there because we're not following someone else's best practices now. We're shaping things. And that means we've gone, if anyone's watched the Lego movie, we've gone from building by the instruction book to now being the master builders, making our own Lego models. Whoa. To me and most creatives, that's a brilliant opportunity, but it's quite unsettling. So I go into all of my programs without a framework. At School of X, all of the frameworks are hidden. So you don't get the chance to tick the box. You don't know where you are. It's a very emergent process. And we don't say to people, tell me what you want. Because I don't know. I don't know what the solution is. I probably don't even know what the problem is, the root cause. I know what the symptoms are. And so we try to unpack it. And in fact, what we do is we try to unpack the emotional aspect of it, because human beings are emotional. This is why our time is now, everyone. We understand emotions. So we allow people to express their challenge through emotion, which sounds very fluffy. By drawing out the emotion, we start to understand why those emotions might be occurring and then what really the root causes of the problems are. And this can be really, it can be very, very eye-opening, but it means we need to stay open-minded. So we kind of corrupt the process. We embrace that very divergent part of the design process. The process is more powerful than looking at the end result. We never start with a solution in mind. That's the fastest route to failure, right? We start with the symptoms of a problem. We understand how people feel, their emotional journey through that, and then we start to narrow down on the root cause of the problem before we go anywhere near coming up with a solution. And we engage people. We believe in grounds-up design, so I have a lot of resonance both with the systems lens and the grounds-up design, because we need to connect the dots there. We see our role as helping people make the connections themselves rather than telling them what we see and how to fix it. So we take people on a really uncomfortable journey, and we do have people storming out of our classroom. I shouldn't say that, huh? People storm out of the School of X classroom sometimes. Why? Because they don't know what success should be like. They don't know how to get an A. There's no exams, so they can't get an A. It's really unsettling, but actually when they give into it and go on a journey, it changes the way they look at things. So we've often been described as, it's a weird phrase that a few people have used, it's like you've lifted the lid off my head and I see the world differently. And so that to me is what we try to do. How we facilitate a bit weird and unpredictable.
I like it. No, I think that's amazing. I mean, and again, I want to lean into this idea of being fluffy. So again, I spent most of my time sort of randomly just trying to ping around academic success. So I started my life in humanities, and I went to the United States, and because their mathematics is not good, I was able to be a mathematics major. Which actually stunned people, because how can go from arts to maths? Shocking. Right? But actually, I think having both of those lenses, and that is a very false binary. And the very false binary between having a solution-driven, I can win an A kind of framework, and actually being productive and help, particularly in a world where when you go out into the real world, there are not going to be any more A's. right? I think that's really very key, and that I think this process speaks much more to the real world of innovation, especially in an area like the arts, where we are able to hold that uncertainty and make that uncertainty productive, is really so key. I'm going to move on to Michael, again, favorite co-author today, and ask Michael, just in terms of starting those conversations at a systems level, and really systems thinking is really, again, about that, like bringing a very clear sense of rigorous thinking without creating a very prescriptive framework around the whole of a very complex system. Perhaps if we could go back a little bit to the prompts and how you feel those should, we could spend a little bit more time looking at them.
Sure. Thanks, Joanne. Well, I've a good student. I've prepared. I don't know if it is useful for us to flash that slide so that if anybody wants to...
Is that possible to bring back the slide on the prompts?
It's on slide 16, but I'm going to start and then people can...
Also, if you read it, it will appear behind you like a magic.
Oh, okay, sure. So I think as we talk about system, because of the social ecological model that really highlights individual to policymakers, but in between it is really about our perception, our beliefs and perspectives and motivation that will then allow us to determine what the causal feedback loop, if it is a reinforcing one or is a balancing one. And I think this is where the check and balance is that needs to be exercised at all these different stratas of decision making. So building on the system thinking kind of framework in terms of signposting us to perception, values, resources, demands and barriers, results, I've came out with this little prompts which I hope would be useful for us to just do a self-check-in, make use of some thinking time, like maybe 10 minutes a day, just to check through these questions. I think firstly, it's really about what are your beliefs and perspectives and motivation in terms of why you're doing what you're doing. Right, and I think what is important here is that as we are doing through this exercise, we are actually also trying to value not just our expertise and our experience, but it's also valuing what other colleagues in different fields are able to bring to us so that we are recognizing assets from different sectors. And then through this is really about cultivating future ecosystem of health and care. I deliberately separate them because I want to make a point that care is also a part of what healthcare delivery or social community, ground level care entails, right? So I think where we are going right now, where we are at right now is a collective readiness for that change of that desired. And all these steps that are sort of like flagged out here are just initial sign of questions, in terms of values, how do we align our values and what kind of visions do we share as organizations, as individual with regards to our ambitions and aspiration for health and care now and the future, right? And then in terms of resources, what knowledge do I have in my sector that I don't have, that I will need other sectors to come in? Because if we do this groundwork, then when we meet partners, or maybe later on when you talk to your partners, try to exercise this, and because it starts to kind of like come into that system. So this is where that mental modeling, that rewiring becomes important, and I hope some of this lists would be useful, because eventually when we are able to line up these values and recognizing the assets collectively, we are then able to kind of like plot the next point, and then we will deliver results that we will then use to challenge the status quo. Yeah.
Great. I have to say that challenging the status quo is my favorite thing. Okay, again, I'm never getting invited back next year. But I hope that also tells us a little bit about how, a very deep process like you would go through with a group like School of X is something that hopefully we can all encounter at some time. But for those of us who don't have the opportunity to do that, actually just starting from these prompts and using these prompts to guide is something everyone can do, just in terms of opening access to that. And on that note, I'd like to come back to Sze-Chin, and I thought it was really, again, amazing to see these concrete examples and to see how things play out in real life. It also reminds me, I think, just in terms of the understanding of how it works, which is that art is made by people, and people also need to be taken care of socially, helpfully, through their art, but also in their daily economic life. And it reminds me again of a book I read by a very prominent, a wonderful book called Lab Girl by Hope Jarrett. And she said, when you ask any scientist what they really want in life, right, and you're hoping to hear, oh, I'd like to see an advancement in the field of nanotechnology, or it'd be really great if precision medicine became sort of more wedded to generative AI. But any honest scientist will say, I need funding. What I would really like is a nice, consistent stream of funding. And that is the fact of the matter, that if we create this value around communities of people, and then we expect those communities of people to be thinking the kinds of thoughts that they need to think, while also riding a motorcycle in rush hour traffic to make ends meet. So I'd like you to come back a little bit to the topic at the end of advocacy and practical advocacy, and maybe say a little bit more about that side or end of the pipeline.
I think it is just maybe expanding a bit on the bits that I didn't manage to kind of wrap up and talk about. But I think I mentioned about like the importance of advocacy and advocating. I was thinking more in terms of like for the artists, how you would advocate for yourself, okay, as a change maker, as kind of like someone bringing in unique perspectives and kind of like advocating for those skill sets with your partner organizations. But the other point that I wanted to bring out was also in terms of advocacy, I was also thinking, because I talked about this idea of an ecosystem, right? So then I think it's important to also advocate for others. So I think in my role as the art therapist at St. Luke's Hospital, I play both the role of a clinician, but also at the same time, I kind of like play some administrative role as well. So I kind of think about how I can develop arts and health programs to bring in other art practitioners to kind of like promote wellness, okay, and kind of maybe not necessarily have to focus on like a very therapeutic intervention, you know, just really thinking about like what the arts can be used for, you know, how they can kind of promote care, how they can kind of promote social connections, so those sort of things, yeah. Yeah, and then I think the other bit about advocacy is I think really related to this idea of trust. I think a lot of times the organizations that I've worked with, you know, I've built up that sense of trust over the years. I mean, it's not, okay, maybe the first time when you're working with them, it's a bit like trying to figure out what are the goals and expectations from each other, right? But I think over the years, as you kind of build up that trust, you know, there's kind of a bit more room to kind of think about even the idea of failure. Yeah. Yeah, and like, okay, maybe this doesn't work out, maybe, okay, or maybe it doesn't work out because we are focusing too much on that end product. You know, what if we kind of turn that lens and kind of focus on the process? You know, what was interesting about that process that we can highlight, that we can bring out, that we can maybe even think about showcasing.
Yeah, I think that's also very critical, and I'd like to link that back a little bit to what both Michael and Tamsin have said. I think just to recognize, first of all, that we are actually embedded in a system and we're working to improve a system. And so it's important both to firstly understand the nature of systems and how they work, but also the practical realities and be very immersed in the actual day-to-day, have a very strong knowledge of where we are and be committed to the exact people and groups in that system, because that actual context is so important. And then coming back to what Tamsin was been speaking about, I think part of it is also then committing to a process and building trust in those people rather than committing to achieving an outcome, right? And having trust that that process, uncomfortable, difficult, sometimes enraging, right? Having some trust in that process and coming back to what you had also said about the healthcare system is really moving from this very episodic interventions in the same way to really nurturing a whole body, right? And that's actually true about the way that we also intervene in designing programs. It's not episodic intervention to the world in which we live, but really sort of saying, let's cultivate this community and let's see how it moves over time. What I'm going to do now is I'm going to open to the floor and I'm going to ask for questions or reflections or responses. This is going to be a traditional Q&A, so we will not be using Pigeonhole, or if you're looking for the QR code, that is not the QR code for this conversation. It may be for our paper, read the paper, but I'm going to open now for questions. Will the microphones be going up and down the sides? And just raise your hand. Yes.
Hi, I'm Terence, and I used to dabble a bit in the arts and health 10 years ago, and we did it for as long as we could, myself and Jody. So my question, I have two questions because, having worked with Pulau Ubin, the kampong, the people, and meeting many people who want to go back to the kampong and seeing the wonderful VR work that you guys did with Moses, hospitals are always very sanitary. They're always, when we tried to bring art into Yishun Hos back then, it was always we had to wipe and clean every crayon and it was tiring. It was very difficult. Of course, then the pandemic happened, and it's going to be very difficult to come back again to bring volunteers to come back to do this again. So there is a difficulty consolidating the two, right? How to get elderly to go out, play in the river, remember their old memories, enjoy the bird songs, the forests and all that, but let the doctors get doctor permission to go do these things. And I think that leads to my second point of view, or question rather. The idea of the day, I think, seeing Michael's slide about policy and community, I think they kind of intertwine a lot more, whereby because we're such a fear-oriented society, I can't get my mom to take her antibiotics, for example. She's scared of all these new things, or they take too much. Everything also they want to try. How do we bring in that narrative so that rather than the fear-based narrative, to get them to let go, relax, play a bit more, be more creative and be more inventive, and to teach us, the artists, about their stories, about their lives, and what we can do to help them. Thanks.
I'm happy to jump in. I think we can share different lenses. Thank you so much, Terence, for sharing that. And I think one of the fascinating things to think about, the opportunity of being in the hospital, yes, it's a hassle, right? COVID made it even harder. I've done a lot of work in Yishun Community Hospital, and I remember the beautiful design of the campus pre-COVID. Beautiful, well done. And then COVID came, it was like going to Fort Knox, it was terrifying, and there's a little bit of legacy left there. We understand the need for clinical controls. So how do we bridge the gap? Actually, I did a project at Yishun Community Hospital years ago where we actually looked at how we could help socially isolated seniors actually better adhere to their care plans after discharge, because what we know is that if they're socially isolated, they are more likely to return to hospital, the frequent flyers, and there are many reasons why. We found that one of the most powerful things we could do was introduce them to befrienders while they were still in hospital. And whether it was an engagement activity there or just befriending, what it did for the senior was make them view the befriender differently. It bridged the link into the real world. So then they continued engaging with the befrienders afterwards and actually came on board with the programs. So I guess it's also, again, about framing what we think the best opportunity of use is when we're in the clinical setting. Because the reality is, and actually it goes to the questions that posed earlier about where do the resources go. The resources are pumped into healthcare because that's where the need is most critical, right? And Joanne could talk for days probably on all of these needs, which means social services, arts, far less well-resourced in terms of driving health outcomes, because we're looking at quickly saving lives, yeah? Clinical interventions at the more acute end. But actually, if we can use that clinical space as a way to bridge connection into the real world, I think that's a powerful angle. A little bit of hassle in terms of sanitizing, but I think there's an angle there maybe about the way that we reframe what happens in the clinical setting, so maybe possibility there. Your second point on policy and community, which I love, and I'm delighted that School of X was really set up to help bridge the gap between policy making in a, dare I say, public service ivory tower and what the real world needs and wants. We're working at the moment on a year-long program with the Ministry of Social and Family Development where we are upskilling youths in their teens and very early 20s to co-design the future youth strategy for Singapore. So actually, oh my goodness, these young people are incredible. They're strategic designers now. They think differently. They were asked recently to define their success metrics, and they turned to me confused and they said, Tamsin, do they mean mindset shift and behavior change? And I went, no, they mean how many likes on a social media post, right? I loved the fact that they saw something more valuable as the outcome, right? So I think there are ways that we can engage people, but for me, everything we do, we start with understanding, motivation. No point telling people what their care outcome should be, because actually I may want something that's not clinically perfect, but enables me to live a different life. If you go to the Cleveland Clinic video that I shared earlier, there's one part, he's determined to be well enough to be at his daughter's wedding. Actually, I may not need to be in perfect health to be at my daughter's wedding, but that is my priority. So how do we start involving people, not patients, but people, in conversations about the care that meets their needs? And I think we're at the opportunity now with Healthier SG to start exploring those outcomes differently. Anyway, sorry, over to the practitioners.
So what I'm hearing from Terrence's question is actually a question that I feel is addressing facilitation. I would like to also sort of like direct us to think about, you know, as we talk about this circumstance that Terrence shared with us, to think about the dimensions of health as we, as an artist, going into a healthcare space. So if part of the outcome is to fulfill mental, emotional well-being while, you know, not helping, but creating an opportunity to allow someone to take solace from the mundane kind of environment, I think if we pay attention to the dimension of health that guide us in the practice, the physical health is also equally important. And I think this is where the cross-sectorial interaction and aligning becomes important, because as an artist, as we go into that space, and how I came into the field of arts and health was really about that. When, you know, I first worked on a project in SGH, I went in as an artist, but as soon as I went into that space working with Parkinson patient, I realized that it's a different animal that I'm tackling with. So I think if we come back to the model of what dimension of health is, and then, you know, using that as a guide to think through the ethical kind of responsibility, the health and safety kind of responsibility, because let's be frank about this, arts is not all positive. But what I'm saying here is also, could we as artists and practitioners and program producer scaffold that so that through the negative or through the challenging aspect of art making, I'm trying to learn to play the piano, it's frustrating, but what I'm trying to illustrate is, this is also another aspect through which the arts, through that difficulty, if we try to link that to the concept of resilience, which is also a health, well-being kind of outcome, there is that aspect to it. So I think as we talk about arts in this context, let's not be too protective of how we view art, as in like it has to be good. But I think the question is, if it is difficult, how can I understand the people that I'm working with? How could I set up a mechanism? And this is where the active ingredient might be useful for us to think about what kind of scaffolding do I want to prepare? Because what I realized in this work is, as we work with community, this work is very different from an artist who is doing a self-expressive kind of work. Because to begin with, we are drawn to people. And if it is the people that we are working with, then, you know, in the current kind of conversation where we are talking about equity, collaboration, right, listening from the fields so that we can actually produce more optimal kind of experience for people. I think as we talk about redistribution of power between the tension of the art sector and the health sector, I think this redistribution of power is also a conversation for artists to have with the participant or the beneficiary that we are serving. Like, do we just parachute an art program? Do we want to actually give space to learn from the community? What, you know, you get what I mean? Like, so it's about a question of rethinking the kind of narratives, like, oh, food and culture, but are there anything else that we can talk about, right? They are conversation breakers, but let's try and short circuit that a bit, right? So that we are actually dealing with other topics. So this is essentially, you know, where we are coming from. And I think the last point is also like the dynamic aspect of health outcome, right? So as we are doing the arts, our instructions, the material, the process, it does affect what that well-being kind of process is. If you want to read more about this, I actually had published a paper called Towards a Caring Practice that's meant for artists, which sort of like put positive health, well-being outcome as the peak, and then within that, how do you actually get through that? Feel free to access that.
Okay, I think what I'm hearing from Terrence, thanks for pointing these points out. But I think what I'm hearing from Terrence is like the some of the challenges, kind of like working with kind of like hospital settings or like more perhaps clinical settings. And my kind of answer to this is really maybe even encouraging those who are in maybe positions of power. So like I think of myself, you know, when I wear different hats, right? So at the hospital, when I'm doing clinical work, I'm wearing the hat of an art therapist. But then when I switch that role and I'm thinking about the programs that we run for arts and health, then I switch myself to the hat of wearing that of an administrator. But then I recognize that, you know, I actually have that power and privilege to be able to address evolving needs, evolving goals, evolving outcomes, and to kind of then maybe relate some of that to like perhaps higher management, so that then I'm in that position to kind of make that change. So I think that's why I was mentioning about the idea of the artist as kind of like a change maker, you know, and once we kind of move and shift our roles into maybe positions where we can impact it from a broader perspective, then I think it's important for us to really consider these evolving goals. Yeah.
Great. Thank you very much. I'm going to now ask if there are other questions from the floor. We have one last question in the back. Yes.
Hi, my name is Adeline. I'm from SingHealth Community Hospitals. I'm a healthcare administrator, and I have to probably plead guilty to Terence's. So I'm the one that purchases the wet wipes to clean the crayons. Yeah. Okay. Yeah. Okay. I'm so sorry about that. Yeah. So yes. Just wanted to add on a bit of a context to this, and you know, like what Tamsin actually mentioned. So clinical governance is required in hospital settings. You know, like, for example, in the COVID example, so, you know, to prevent spread in that case. So, but I just wanted to share the work that we've been doing in SingHealth Community Hospitals since 2019. We've been very active in social prescribing. So thank you very much for the plenary speakers for bringing that up. And we have a wonderful team of well-being coordinators here today as well, who would certainly attest to the work that art has brought to our patients. You know, like what Sze-Chin mentioned, it's art after art that has brought confidence to social prescribing and to our patients, that it has been very useful, and such that we have embarked on this engagement and partnership with National Arts Council and Agency for Integrated Care. So, you know, we are very glad that we're not thought of pariahs in this community, and thanks so much for inviting us. And I think really it is about freedom within the framework. You know, so understanding that these are clinical protocols that have to be done, and there has been anecdotal validation for the artists that your work is absolutely required in this arts and health space. But bear with us, you know, these are some protocols that we'll need to work within, and there is, I believe, there would be creative expression within this framework. So don't be discouraged by having to disinfect the crayons. I'm so sorry about that once again. But please work with us, and we can see the impact that it has brought to our patients. And so thank you very much for the artist community for that. Thank you very much.
Yeah, thank you. It's great to see that on the ground as well. I think part of it also, if I may say, is a little bit about, I think, the distinction actually that Tamsin set up at the start, from the spectrum going from health to healthcare. And so when we use the word clinical in a clinical setting, it's always the case that at the end of that spectrum, it will be a very sanitized. And in fact, when we see the avatars, not even real people, it will be absolutely in an operating room. There is no question about what needs to be done, and the primacy of the clinical environment, the need to control infection, all of those are going to be absolute. But on the other end of the spectrum in health, in the population setting, and even in what's considered a healthy environment for young children, if we think about antimicrobial resistance, it is about actually exposure, being in the dirt, probably eating some of the crayons, and then maybe appearing back in the A&E lah. But navigating those binaries, I think part of what we're all sort of talking about is coming from different stakeholder perspectives to see in which setting, in what place, do we moderate those biases, and do we make those binaries a little bit less binary to make sure that we can bring the human-centered piece as far as we can into that space. And again, I think palliative is very key, because in palliative we already understand that there's no cure. So we are there saying, you know, give the man a cigarette and a beer. Right? That's where we are. So I think understanding that and I think exploding binaries is what art is supposed to do, and having those conversations with these prompts very mindfully is so key. Mike?
I just want to add to the point of healthcare. I would really love to bring in the word care, because I think just to focus on healthcare, you know, that kind of orientation and signposting, because at the end of it, when we talk about care, it comes back into the social aspect, it comes back into the physical, it comes back into where care happens, who can be part of care, because the dominant narrative now is care is subscribed by medicine and social care. But while we are activating the arts, we are also trying to build capacity and activating individual to be part of that ecosystem, so that maybe in 10, 20 years' time, a little bit ambitious, we might not be even talking about this anymore, because everybody will be savvy enough to do what they think is best. Yeah.
Hey, so we are actually, I think, going to run down the clock a little bit. So I know we could be up here forever, really. But I'm going to actually use this time to actually ask each of my panelists to take a moment just to reflect on what you've heard from the others as well. And maybe in the spirit of what's next, to speak about what you think actually in this conversation or in facilitating this conversation. I think we all facilitate it in different ways. Tamsin through her work with policymakers and on the ground, literally on the ground in these workshop sessions. Michael through moving research forward, and Sze-Chin actually through the practice on the ground and in building the capacity on the ground for the healthcare sector. What do you think is the most, if you had to look forward now, what do you think is the greatest need or opportunity where you can contribute, or you are contributing, or we as a society should be contributing? And maybe I'll go backwards in this.
I think I was struck by what Michael mentioned about like how, I think he mentioned about like healthcare in a relational manner. And I think the other day I was just chatting with one of my directors at Jurong Health, right? And then she was sharing about this article of a doctor, I think it's in the Straits Times a couple of days ago, but how the doctor was saying that she's so focused on treating the patient that she really forgot to listen to the stories of the patients, you know. And I think this part is quite key in terms of, especially in relation to arts and health, you know, really being able to relate to someone, to be able to care for someone. And I think that's what I've gained and out of some of the sharing here.
For me, this is something that I've been brewing and I'm working on. I'm actually very interested to create a creative health consortium. So this will actually comprise of stakeholders from different sectors, so that we create a space for us to have more dialogue and to explore how we can come together. So if you are interested, leave me your names, I'll get in touch.
I have no call to action, but I endorse that. Many years ago, I founded something called the Smart Health Leadership Centre at NUS, and it took a very different and provocative lens. People told me at the time, you should be focusing on one part of the system. Is it healthcare? And if so, which part of healthcare? And I said, no, it's not healthcare, it's health. It's health outcomes. Care is a part of that. But my push all the way back then and sustained now is that if we want to see a change in the world, we all play a role in it, but we all need to understand the role we play. Transformation, whether it's in an organization or in a bigger ecosystem, requires all of us to see a vision that we want and understand the role we can play. And I think that's where, whether it's on a micro project level, whether it's about my own self-care, or whether it's I want to change, I want to create a movement, actually we have the ability to do that. It all comes down to understanding human beings, and humans don't like doing what they're being told to do. Even in Singapore, where we know we'll be fined if we don't. Actually, we find different ways of expressing resistance. I love the point earlier made that artists are change makers. It's how we sneak change into organizations. We bring it through a creative process. So take that time to be creative, use your creative powers, connect with people and use a collaborative approach to drive the change you want to see. I believe firmly the power lies in all of our hands, so let's go.
That is a terrific ending for this talk. I think, guys, it's been amazing to listen to this. I think one of the things that I've taken away from this also is that when we talk about art making, really it's also about creating a narrative in all of these different ways so that we can help connect on a also common basis with other people. And that's what makes, I think, art so important. It's a process that we commit to tell a story and bring our story to others. And we need to do that in all of these different ways, and also to policymakers. So to policymakers, I think that is very key. We hear a lot about how we need to articulate the value of the arts. I think there's been a lot of articulation of the value of the arts in perhaps a language that policymakers don't always listen to. So I would say that, you know, just in terms of understanding, I would also share, by the way, one of the things that just came out from the Institute of Mental Health very recently, and they shared that 2 things that we already knew. 1 episode of adult depression leads to all kinds of societal costs in 1 year, over hundreds and hundreds of dollars. But that 1 episode of adverse childhood experience leads to $800 of societal and medical cost every year for the remaining lifetime, which means that every year in Singapore, over $1 billion, in fact, several $1 billion, is attributed to this alone as a hidden cost. And so if we think about the fact that art helps to mitigate even a small amount of this in early life, for older adults, for those of us struggling in the sandwich generation, all of these costs, if we want to talk dollars and cents, are there if we want to speak that language. And so I would say to you again, I don't know how many policymakers there are in this room, but every time you ask an arts person to do a cost-benefit analysis, you should also yourself go to one of Tamsin's workshops. And that will be a very good quid pro quo, and we can very happily do it for you. Thank you guys so much for this conversation. I've really enjoyed it. Thank you for the input and for the questions. And I think that we have a very well-deserved mental break to the next transition of the next few speakers. Thank you, everyone.
Thank you. A big round of applause for all our panelists, for Joanne with her brilliant mind, and to our audience members for asking such good questions as well. Thank you so much. Well, moving swiftly along, we now begin the first of 3 case studies for today. To start with, I would like to invite Dr. Samuel Wong, co-founder and creative director of the TENG Company, to present his case study entitled Music for Mindfulness. Dr. Samuel Wong is the co-founder and creative director of the TENG Company. He holds a PhD in ethnomusicology from the University of Sheffield. His work at Tang focuses on music in applied settings and innovating within tradition. A bit about Music for Mindfulness. It is an innovative music experience that promotes wellness and reduces stress and anxiety using binaural beats and ancient Chinese philosophies of music therapy. Oh my goodness, I'm so excited. A warm round of applause as we invite Dr. Samuel Wong.
Thank you all so much. I have to credit National Arts Council for creating Tang for me, because 2004 was a time that we joined a national music competition and I had to find a name for our ensemble. I flipped over the Chinese dictionary and found the most difficult word. And it was this word, Tang. And then I subsequently, 20 years later, we are 20 years old right now, we are now a company that actually works with an innovative way in our approach to music. All of our music making is mostly evidence-based. We also work with various different types of researchers to create very unique musical experiences. And the most interesting thing about our product here, Music for Mindfulness, is that it's a mixture both of art, science, tech, and tradition. When I brought this experience to Hong Kong last year, I think a lot of the people in Hong Kong, their jaws basically dropped because they didn't understand how I could actually, or how we could actually have done something like this. Music for Mindfulness features binaural beat technology, but let me explain for us a little bit why this happened. This product grew as a result of the pandemic. We started this in about 2020, and there were 3 reasons why. The first was that there was a youth mental health crisis that was going on. Number 2, the pandemic also heightened this process. And number 3, we wanted to bring anxiety-reducing music to people's homes. This was an offshoot of another program that we have. It's called Tang Gives Back. And some of you might be familiar with this program, where we play music in clinical settings with supported by music therapists. During the pandemic, we couldn't do that. So we decided, why don't we innovate and we create something absolutely new? And we want to alleviate mental stress in our community using our music. And a little bit of extra information, Music for Mindfulness, the Tongue Gives Back program right now is going through a research process with Center for Music and Health at YST, which is the National University of Singapore's Yong Siu Conservatory of Music, but that's a different product altogether. Here is where we have a little bit of yin and yang. Chinese music, some of us are familiar with Chinese medicine, and some of us are familiar with Western medicine as well. This is where Tang is supposedly good at both, because we marry both together. In Chinese music, in Chinese philosophy, you have the 5 elements, 金木水火土, which is basically metal, wood, fire, earth, and water. And they correspond to the 5 scales of the music, the pentatonic scale, Gong, Shang, Jue, Zhi, Yu. And it's believed that in ancient days, that if you were to play certain types of sounds or certain types of reverberations, it will be able to clarify your mind, and it will also give you a sense of center yourself and give you a sense of mindfulness. That is why a lot of people go for sound baths. When they gong, and then they sort of like feel they're a little bit more centered. But it's basically certain types of frequencies that are being played. And it is believed that if you play in various different types of frequencies, you can actually also affect different organs in your body. And it is very unique because Chinese medicine looks at everything in a holistic way. You don't see, in Western medicine, you're specialists. For example, a cardiologist, etc., etc. A Chinese medical practitioner sees your whole body in a holistic way. So the Chinese practitioner never sees you as a specialist in it. So they don't go for heart or limb or blood or a cancer specialist in that sense. What are binaural beats? Binaural beats are actually not new. This is a Western technology in which it is an auditory illusion. An auditory illusion basically means it is not real. What you do is that you play conflicting frequencies on both your left and your right ear. For example, if you play 200 hertz on your left ear. On your right ear, you play 204 hertz. Your brain can't take it. It will produce 204 minus 4, that's 4 hertz. And this auditory illusion is known as the binaural beat. There are many different types of binaural beats, so I'm going to put here. 0.1 to 4 hertz is delta beats. This is a brain state where it's known for deep sleep, pain relief, anti-aging, and healing. 4 hertz to 8 hertz is REM sleep, deep relaxation, meditation, creativity. Alpha, beta, so alpha is 8 to 13 hertz, 13 to 30 hertz, gamma. So this technology is not new. It's been used all around the rest of the world. A lot of Western studies have actually been done with regard to binaural beats as well. What Tang did was that we created a whole entire series of 10 tracks, and we worked within the theta beat, which is 4 hertz to 8 hertz, and 0.1 hertz to 4 hertz, which is delta beats. So we created 10 tracks. 6 tracks used Chinese music together with the theta beats. 4 tracks used Chinese music with the theta beats. 6 tracks used Chinese music together with the delta beats. The aim for this was anxiety and relaxation. And then we didn't want to say it works. We went to prove it. So I'm going to introduce, this is my co-collaborator, Assistant Professor Peter Tay from Singapore Institute of Technology. Oh, Peter, can you please stand up? Singapore Institute of Technology is the only school that has allied health as a department. So it works with occupational therapists, radiographers, etc., etc., etc. Most of the other universities in Singapore always work with medical schools or nursing schools, AKA. But allied health is something that we thought was very important. And Peter worked with us in 2020, and we partnered to conduct a study. And this is the largest binaural beat study in the world. And it works with both physiological, memory, as well as psychological motor outcomes. We had 3 groups. 1, Tang music with binaural beats. This was 52 people, 52 students who listened to it. Number 2, Tang's instrumental music without the binaural beats, just purely the music alone. That was N equals 52, also about 52 students. And then as a control, we had an audio book, which is about 47 students, and they listened to this for 30 minutes. Of which 32 students underwent physiological measurement. When you're nervous, you sweat. So we basically had sweat gland monitors, and we also measured heart rate. And the participants were also measured in terms of socio-demographic as well as psychological questions after that. What were the results? Ta-dang. We found that participants who listened to Tang's binaural beats reported lower state anxiety than those who listened to an audiobook. This was statistically significant. And so this is the audiobook, this is the anxiousness, and then this is where the anxiousness after they listen to it. Number two, it also showed that it's an increased arousal from how you showing the beats having an effect on the body. Number three, it showed that people who listen to Tang's binaural beats recall fewer items in terms of memory. This meant that you were in a deep state of REM and you probably forgot what on earth you were doing. And as a result, you actually had some of these interesting results and findings. So with these results and findings, we created a whole entire album. Amongst the first few people who listened to our binaural beats was the Minister of Culture, Edwin Tong, as well as Ms. Lo Yan Ling. And so this was during the pandemic period, and they said, I could give you something that would send you to sleep. And they were like, huh, really? Yeah? That it can help reduce stress and anxiety. Huh, really? Yeah? Okay, let me do this. And when Edwin Tong actually put it, he said, I feel as if I'm sinking. Because it's almost as if you're sinking down to the floor. And all this is because of auditory illusions. This is not real. It's because your brain is entraining yourself to thinking that it's more relaxed. Since then, we have partnered, Tang has provided quite a number of this to beneficiaries. Caregivers Alliance, Limitless SG, these are mental health charities. We don't tell them how to use it. We give them the tool and say, why don't you decide how you use it? And so some of them have used it for grounding therapy before counseling. Some of them have used it during counseling. Some of them have used it as part of pain management. National Kidney Foundation, St. Andrew's Nursing Home, St. Luke's Elder Care, All Saints Home, Singapore Association of Mental Health. We provide this all for free to all these beneficiaries. But it doesn't mean that we don't make money. Let me explain. You can now hear this in Singapore Airlines on all the flights, and you are hearing it all around the world. In fact, as we speak, somebody's playing some of it somewhere around the world right now. On top of that, the Chinese University of Hong Kong invited me over to give a speech on this, and this is where I think Hong Kong's sort of jaws dropped because they have emphasis right now on art and tech. And so everybody was going AI, VR, virtual reality, augmented reality. And I said, why can't we use something that's traditional and then after rework it and then work or something like that? Because of that, the Chinese University of Hong Kong actually has a binaural beats corner as well in the library for their students to use as well. Moving ahead, Shangri-La is using our music, in their better sleep programs, and we have been credited in Channel News Asia. It says by Kevin Fu, who is the head of Sony Music, and it says TENG Company is one such example, calling it a great cultural icon. I beg to differ. The Arts Company reimagined Chinese music as partner with Shangri-La Singapore to produce music for in-room headsets under hotels, music for mindfulness experience. There is some commercial viability to this as well. So while we help society, we too also sort of make a little bit of money. Moving ahead, our findings have been published on the International Journal Psychology of Music as well. And moving ahead, we are also researching an extension from this. We have recently concluded a study on our music for mindfulness experience with the silver generation, and we are also upgrading this and working on future research with regard to this thing called monaural beats. The thing with binaural beats is that you have to use headphones to hear it. With monaural beats, you can take out the headphones and just hear it via good speakers. So previously, during the break time, you had a small little corner where some of you could have experienced the binaural beat program that we've created. I'm not sure if it's still around after the end. But if not, I'm done. Thank you guys very much.
Thank you, Samuel. I think we have time for just one quick question.
Yes.
You had me at anti-aging, to be honest. And then after that, when I realized that you would then accelerate my perimenopausal memory loss, I was like, wait a minute. But then I understood that you have the solution to all the turbulence fears that we now have on Singapore Airlines.
Yes.
That is a big social impact.
That is,
right
yeah.
there.
So you
right
can
there.
go on and you look at, there's a sign there that says, oh, music binaural beats to help you, especially people who are very anxious when they fly.
i.e. myself. Okay.
Okay.
Fantastic. So the very quickly, I think, and again, because we do want to move on to the other things, I just want to ask, it sounds to me like this is just a blockbuster. Again, you had me at anti-aging, I was already sold, yeah. But what are some, if you could just say very quickly, have there been any challenges moving this forward? Like when you were listening, do you resonate with any of the challenges that you heard in the arts and health space, and how have you sort of addressed those?
I think the issue here is the challenge that we first started was that this was started during the pandemic. And then a lot of resources were not available to us in that sense. The second thing was to actually find partners in which you could all work together. I think a lot of us in the health and arts space all work in almost individual silos. And because of that, it's like, oh, what I'm doing is might help somebody else, and there are applications that person can use my work to support the other work. And so we're having a little bit of, I find the problem's an ecosystem problem. I don't really find it as, I think everybody produces valuable research and valuable work. But the large part is that when we don't have an ecosystem, we don't share their work and we don't leverage their work. And when we don't do that, then we lose. So we need to create win-win solutions for the whole entire community.
I think
so the community needs to work together.
That's amazing. I think when we hear these success stories or what seems very successful, sometimes it's hard for us to remember or to imagine that there have been challenges, but it's amazing to hear that those challenges actually resonate with everybody else's starting challenges, and starting those conversations is always
And I'm under time, right?
You are, but you know what?
Right.
Thank you so much.
I was looking at your time and said, you guys are probably going to overrun, so I'm going to make mine fast.
There you go.
Okay, thank you guys
Well,
so
thank
much.
you very much, Samuel, and we will be in touch, yes.
Thank you, Samuel, and thank you, Joanne. Okay, next up we have Ngiam Su-Lin, who will be presenting Both Sides Now by ArtsWok Collaborative. Su-Lin is co-founder and executive director at ArtsWok Collaborative. She has been active in the Singapore scene for more than 2 decades, specifically in the areas of education, community, creative producing, and in interdisciplinary collaborations. Su-Lin will be speaking about the Both Sides Now program. The sharing will demonstrate the value of arts for having end-of-life conversations and community building. Su-Lin, please.
Thanks so much, Shada. Hi, everyone, and thanks so much, NAC, for the opportunity to share about Both Sides Now. It's really lovely to be here, seeing lots of friends, familiar faces, but also quite a lot of new faces this year, so that's wonderful. So ArtsWok Collaborative, so we are an arts-based community development organization, and really we work at the intersection of arts and communities, looking at community development outcomes. And we believe that individuals really have the agency and also the creativity to generate change. So looking very much at how individuals can make that happen and how the arts can contribute towards that. We've been around for, this is our 11th year. It's been a tremendous journey. We can talk about it later. But to be in the nonprofit space, yeah. But anyway, we work as intermediaries, facilitators, and creative producers, essentially connecting people, ideas, and resources. And when we started, many people didn't understand, what do you do as an intermediary? And it's taken us a while to articulate that well also. But essentially, we are bridge builders and collaborative because, so ArtsWok Collaborative, because we really believe that we can't do this alone. No sector can do this alone to generate change, to work with people to generate change, to do community development work. So this is really art, social, health, community, different sectors coming together. And the key is, how do we collaborate? And those of us who do collaboration work knows that it's not easy. So what sets us apart really is our arts-based approach, right? And the arts being able to tap on creativity and imagination. We create a lot of safe spaces through the work we do, so facilitation of safe space, so that people can engage and unpack complex issues. So the difficult things that we need to talk about, they're important. I will be sharing about Both Sides Now, which is about end of life. But we've also touched on topics like poverty, disability. We almost did a project on race. So I think the tremendous value of the arts is in being able to tackle very complex issues, because it does create spaces where we unlock creativity, imagination, and then have lots and lots of conversations and engagement. So we produce innovative projects that demonstrate the power of the arts for change. We also do capability development of community engaged practitioners, again, not just in the arts, but across different sectors. We do a lot of network building across sectors. Again, some of you may have been to our greenhouse sessions. Earlier this year, we had a learning forum, which is our first for about 150 cross-sectoral practitioners. And we also do research and advocacy for arts-based community development. So both sides now, it's one of our flagship programs. And we've been doing it again for 11 years since the beginning of ArtsWok. And essentially, we want to develop spaces, literal physical spaces, psycho-emotional spaces that encourage end-of-life conversations through arts practices and creative approaches. So we work with individuals, families, communities, and the idea is to enable them to explore, express, and act what living well and leaving well means to them. So our tagline for both sides now is living well and leaving well, hence the both sides. Because they're very deeply interconnected. If we don't know what living well means, it'll be hard to leave well. And knowing how we want to leave well then influences how we live, right? So it is a relationship. I don't have a lot of time to go into detail on the project. It has been 11 years of practice. So essentially this would be a very kind of quick summary. But we have brought this program, which I must say was originally commissioned by Lian Foundation and Ang Chee Mo Foundation, and they funded us for a good 7 years. Wonderful funders to work with, really left us alone to do our thing, which is great. And then I must also say we did this project with Drama Box. So some of you may be familiar, they're a theatre company in Singapore, and we worked together for the first 10 years to do both sides now, and then ArtsWok is continuing this journey with both sides now. So we essentially did public outreach festivals. These were in different communities. We were in like Khatib, Toa Payoh, Chong Pang, Telok Blangah, etc. So place-based communities. We toured a puppetry program to 50 different senior centers, and then we conducted 10 different community engagement projects. And this means essentially for community engagement projects that we work with different artists. So it is multidisciplinary, it's beyond just drama, visual art, we work with dance. And artists work with community members or residents, usually seniors, but they do cut across demographics. And these are workshops, arts-based workshops over a couple of months. And then they explore end-of-life topics, have, we call it like rehearsals for life. So they're actually having end-of-life conversations as they're experiencing the workshop, as they're talking to one another. They're already rehearsing. What does it mean to think about and talk about end of life? And then we create artworks together, and then these are then installed or shared during the festival. So we've done this model, this methodology for the first 10 years, and we're evolving it. So for those of you who like numbers, these are just a summary of stats across the 11 years of doing largely a festival and workshop approach. So we survey participants, audiences who come through the festival, which is usually about a week long, sometimes shorter or sometimes longer. And these are some numbers. So 88% intended to follow up on end-of-life issues. 87% gained an understanding of end-of-life issues, 90% understood and related to the themes and topics presented. Because end-of-life actually encompasses many, many different things. Our values, our wishes, grief, loss, the relationships in our life, frailty, aging, so many different things, right? So sometimes it is challenging thinking about how do we unpack that and then curate that into process, into art making, into then sharing that. Yeah, so anyway, 72% were largely between 19 to 45 years old, and 94% found the festival interesting and enjoyable. So what this means is the arts-based approach and going through creativity, and then a lot of the engagement on site is also participatory, so people really want to locate themselves in the work as well, right? So they may be experiencing an artwork, but what does this story or narrative mean for me? When I'm reflecting on it, what is the relationship to this? What can I learn from it? How can I express myself? How can I create? How can I share and participate also, right? So these sorts of approaches are really, really, they go very deep, yeah. So in 2023, which was last year, we've kind of evolved our methodology to move away from the larger scale kind of public festivals, which can attract thousands of audiences, but into more, we wanted to deepen our community engagement approach and really look at community development. So I'm not sure how many of you are familiar with ComDev approaches, there's asset-based approaches, and what we're trying to articulate here is what's the arts-based approach to community development. We also subscribe to a strengths-based, asset-based approach. And this was our pilot in Yishun, so Yishun Health came up a lot today. They're wonderful partners. We've worked with them for 10 years as well, and this was at one of their wellness kampongs. And we worked with Salty, who's a socially engaged artist, over the course of a year, and we were piloting what does it mean to really work longer term. So we worked with a group of 8 core seniors over the course of 9 months. And then where else can the work go, but with the seniors leading this process, right? So we're doing this with them versus to them or for them, right? So our objective was to expand and deepen public conversations and community support around death and dying through creative approaches. And the longer term outcome really is to what does it mean to be a supportive community that enables one another to live well and leave well. This approach, so I mentioned arts-based, asset-based, we looked at things like, so broadly end-of-life issues, and the seniors unpacked that for themselves. Some wanted to talk about it through being a single senior. Some of them want to talk about it through caregiving. Some of them want to talk about it through intergenerational relationships. So again, there are many ways to talk about end-of-life and preparation and what's important to us. We talked about advanced care planning, which is an instrument. I think some of you may be familiar with that, ACP. And then Yishun Health adopts a personalized care and support planning approach, and apparently I have 1 minute. So, okay, I'm going to speed along. So we had workshops, conversation spaces, and I just want to say something about senior participants as civic agents, because they have agency and they very much want to contribute back to their community and back to society, but often we pigeonhole them or we label them, and this project was really, I'm just going to put the QR code there. There's a project video and you can watch and find out more. But for the 8 women who went through this process, they describe it as transformational because they learned how important they still are, that they can contribute. They learned how to talk about their identities, what's important to them, their narratives, as well as learning skills and connecting with community and all of that. And I just really want to go to this part, which is essentially the pitch. And so we want to continue this work in Yishun. We want to continue our community development approaches. We are looking out for new sites to bring this work to. We are open to, sort of coming in from different aspects. So, I know participation from males at senior centers has traditionally been an issue. It still is. How can we have culturally competent approaches where we are reaching out to men? There's a particular edition of Both Sides Now where we did an approach with the Malay Muslim community. How can that continue? But it's more place-based. We are looking at developing a shorter-term program because I know 9 months can be daunting for perhaps many community partners. So what does it mean to do then design a shorter-term program? We're clear it's not a ComDev outcome. You can't do the development in 2 months. But it's really about community engagement. It's about talking about end of life and doing some level of thinking through and conversations. So what can for example, 8-week program look like? We're designing that now. We want to go into active aging centers. I know that's a kind of a newish model in health, and we're learning more about that. So any of you interested to have us, please come and talk to us after this, or even family service centers and all of that. We also do training, as I mentioned just now. So how do we train more artist facilitators? That has been the challenge in the arts, having enough artists who are interested to do community engaged arts. That's a whole topic for discussion. But we want to increase this pool. And we also deliver training to care workers, so social health community care. Last year, we piloted workshops with SGH, the medical humanities team, who were looking at how to increase self-competence in having end-of-life conversations in care practitioners. And we brought in a drama-based workshop to do that. So this is something we want to continue doing. Just partners we've worked with, that's me. Oh, my email has become blue for some reason. It's Su-Lin at artswok.org. I'll be around after if you want to chat. My fellow colleagues are on the front row, so I will be around for lunch. So come and speak to us, please. And that's the URL for more information about Both Sides Now. Thank you so much, and sorry for overrunning. Yeah.
Perfectly fine. And I think I get to ask you one question.
Okay,
so
okay.
I have to, it's very stressful for me because I'm like, how can I ask you just one question?
Okay.
Yeah, I think end of life is actually so important for us because it's one of those nexuses where we keep talking again about cost and why cost escalates so much. End of life is one of the most costly periods of time. in an individual's life. And the reason why is not because we have amazing interventions at end of life. It is sometimes because family members are so emotional that that is the moment when we try to substitute time for money, and we don't know how to express care, so we just throw as much money as we can at the problem, or we haven't thought about it, we haven't planned for it, so people need to come from far and everything is on an emergency basis. And so what that means, I think, is that some of what you're showing here and that mindful thinking is actually about how to do less, or how to do and get more, and thinking about that very mindfully to create a good end of life that actually does cost less, but is more valuable to people. So I'd like to also really ask you, just in terms of prioritizing, and you know, we talked about a lot of possible next steps and all the things that you do. And actually, having experienced some of both sides now, I can tell you guys, I'm very fully bought in. Thank you for having me part of the experience. But what would you say of all the things that you mentioned just now, the artist residencies, which take time, the community engagements, which are short, the training of people on the ground, which is the most critical part, do you think, if you could go forward and you had to sort of just make one big wish?
Wow, it's a trick question.
It is a trick question.
It depends on what you prioritize. I mean, if you're thinking about reach and wanting to reach more seniors, then I think the shorter term programs, you can go to more centers. You know, there's more benefit in that sense, reaching out to more seniors, but we can't go very deep. So the beauty about the community development approach, which is an investment of resources, is we are actually building capability and capacity within communities to build and to vision first, and then to work towards the change that they want to see. So I would say, I mean, my passion is really in that area, because how do we, through the arts, impart, you know, skills? How do we create spaces where they can be having conversations about things that matter to them? How can we together work on coming up with processes or ways of collaborating, you know, be it artists with resident with resident, you know, resident with healthcare worker, but how do we then create new ways of working that is resident-led or resident-centered? I mean, it's their ideas, it's how they want to work. And this is an investment, because over time then they are learning how to do it, and then more and more people can, and there will be a ripple change, right? Because shorter term programs, yes, it's very much focused on the individual, maybe their friends, their family, but are they learning sort of skills in order to generate larger change for themselves or more sustained change for themselves? That is the question. And I think there is an over-professionalization of services. No offense to the professionals in the room. I'm not saying that you guys are not important, but we will never have enough professionals serving people. I think there is a huge problem now, and we are not teaching people how to fish, right? So I think, you know, services are not always the solution. So how do we build, again, capacity and capabilities within communities so that everyone can step up? I mean, this grounds up movement that we're talking about, this is a different way of working than delivering services too, and there's a role for each, but it's heavily, resources and the emphasis is very much on service delivery at this point in time. So how can we balance it out?
I hear you. I hear that it's not about one service and that's the magic bullet. It's about actually what's critical is knowing the community first, and then understanding which and how we change the services to fit what's needed on the ground, rather than saying, I am an organization that delivers X. It's about saying, I am an organization that knows this community and will help it to that next stage in the way that it needs to be helped.
How can the community help themselves without services only? Yeah. Thanks, Joanne. Yeah.
Perfect. Thank you. Shada?
Fantastic. Thank you, Su-Lin, for the good, sensitive, powerful work you do. Moving on, our final case study for today is entitled Harmony in Motion by the Esplanade. Harmony in Motion is a dance project that seeks to foster social connectedness and mutual understanding among youth and seniors. This case study is presented by none other than Grace Low, who is the head of customer and community engagement at the Esplanade Theatres on the Bay. Besides managing the customer experience, Grace also oversees the community engagement team that organizes some 600 activities each year for underserved communities. Please put your hands together in welcoming Ms. Low.
Hi, thanks everybody. Really happy to be here. So heading up the community engagement team, and we are a dedicated unit. We've been around for 10 years that actually bring the arts beyond the walls of the Esplanade. We're hardly at Esplanade. We're out in community, really going out to, our universe comprises at-risk youths, children, vulnerable communities, even those in crisis situations. I felt it was very important in the lead up to what I'll be presenting about harmony emotion that actually we are quite moving for very intentional, that actually we need to have intergenerational intervention in the programs that we are doing. If you're looking, and what you've heard the speakers earlier, right, mentioned about looking up in Singapore, the next 20 years, the whole silver tsunami, etc. But our strategy at the Esplanade, even beyond community engagement, is starting young. How do we involve young people in the work that we are doing? How do we build, through the arts, the next generation of a young adult with the empathy for an older person? That it's okay for generations to coexist together. There need not always be that gap. So I want to talk about very roughly, just as this is a date with friends. This is a program that we run for seniors that takes place on an annual basis. But the intergenerational intervention in the programming that we do is we work with youth volunteers for this program. We even actually intentionally pair up-and-coming youth musicians, young artists, that they need to be in the same stage, share the stage with an older musician, for example. So my programming colleague is very intentional, even for his senior festival. He needs to think about the intergenerational intervention that needs to happen even on the artistic front. Yeah, just an example for this. So we run, in terms of our Single Out program, is a program that we developed for persons living with dementia. And what you see is the picture on the left. That's a program we did with St. Joseph's Home. And we actually involved preschoolers that were involved in this intergen program. And this is a quote by a parent that they hope that actually the kids will know that, how do I, because in any family setting, you will also know someone with dementia, and it's okay. It's okay for a young person to understand what's dementia, for my grandfather, an older relative, and how this program actually brought about that whole conversation and bonding. That's true, the thing. The picture on the right, it's a program we did with Apex Harmony Lodge. I see some of them there, where we actually focus on family involvement. This is a 3-generational family involvement, and we felt it was very important through the arts. How do we actually have that space for families to be involved, because aging and issues of health strikes at the heart of a family in the reality. How do you then, through an arts program, take it into your home and open up that conversation? So this is a program that we ran this year. So Harmony Emotion is something that we created. This is a program we ran we started from 2018, where we work with vulnerable youths, and as well as socially isolated seniors, bringing them through a 2-month program that culminated with the showcase at the Esplanade. I think what was important through our program is we were not there to teach you how to dance. Yeah, very clear. Our instructions to our artist facilitator is we are more interested in the process than the end product. The important thing is we stress a lot about co-creation. We stress a lot about making sure that through the dance program, the youth as well as the seniors understand, not through conversation, through the movement of bodies, a better understanding of each other, and through that movement, it becomes that creation, the choreographed parts of the piece that end up as a showcase. So that was very important. You're not supposed to follow instructor each step. No. You are part of that creation process. You're part of the choreography for the dance program. Just a quick snapshot of how we work. In a year, the Esplanade, we do about, these are flagship programs. They are about, from the shortest is 2 months, and I think the longest we've done was actually we went with the Khoo Teck Puat Hospital was 7 months. We play an intermediary role. We project manage. We assemble a cross-agency, cross-organization project team, identifying a community partner. So this is a program, Harmony Emotion, we work, that happened this year from February to April. we had Bowen Secondary School, and we work with the care elderly at Golden Ginger Active Aging Center. Artists, I think you saw, yes, Edwin's here from Decadence, yeah? Really great partner, very like-minded in the way we wanted to work. Definitely, we work on the social professional, the Shine Children and Youth Services. They actually, so these were the youths, they were in part of the Gear Up program at Bowen Secondary School. Of course, Esplanade is a charity, so thanks to the Tan Jun Chuan Foundation, we were able to run this program. Specifically in the objectives of the program, I think what's really clear for us is how do we create that safe space, a safe environment where both young and old can be together. I think for a lot of the youth in this program, there was definitely apprehension, right? I'm going to dance with, what is it like? And if an older person, actually a couple of them, you'll be surprised, actually they feel intimidated to be in the presence of a young person. So for us, what was really important through a dance program, that it was important to have that social connectedness and interaction. And how do we challenge stereotypes, right? From perspective of the young, old people, we think they can groove and dance. And then for the elder person also, can I do this? And I think a lot had to do also self-perception, right? For an older person, I'm old, I cannot. How do we change the I cannot to the I still can? Yeah, so that was very important for us as well. And these were the key objectives for the program. We look at the youths and the seniors. In this program, we ran it for, there were 9 sessions. Two sessions were taking place respectively at the school and the seniors, and then the combined sessions. The school had more space, so I think we had to bus the seniors over the space, and there was a graduation showcase at the Esplanade. I think one of the key things about this program, and thanks to Decadence as well, was the ability to how do we, through a dance program, so it was a contemporary dance, contemporary dance movement. So I think they incorporated elements such as the mirroring, where a youth will lead, so they were like a buddy system. We paired a youth and a senior together. In total, I think we had 16 youths, 18 seniors for the program. So through the mirroring technique, how do you follow? Who takes the lead at which point? There was also a part called the contact improvisation, right? We blindfolded them. And how do you feel the movement, your hands? So we link the arms and hands together and feel, using your body and the sensation. How you feel that movement? And the last thing, I think, was sculpturing. So imagine you are a sculpture and somebody was molding you. So each took turns to be the sculpture, to be the molder, how to say. And I think, am I running out of time? I'm just looking at the thing. Yes, I see 2 minutes. I will end with the project video. Yeah.
They say elderlies are quite fragile. They can't really keep up with all the steps, but surprisingly she can, and she teach me a lot about dancing as well.
Sometimes he touch me, I know when to turn and when to come back to him. That's the best part, that we can collaborate.
I'll finish our training, she will talk to me. Hey, you are doing well today, and she will always say, high five. Hey.
Contemporary dance has a lot of freedom. It is a lot more accessible for people who don't have experience. And the whole purpose was to find opportunities for them to bridge the generational gap. We did a mirroring exercise. It becomes a dialogue, it becomes a conversation just through movement.
So when we are doing the mirroring, I tried to move slower and much more easier for her to follow. But when I'm mirroring her, she was very fast. She's stronger than what I thought she was.
We had hoped that the youth could develop that sense of care for the seniors and thereby also enhancing their self-esteem and self-confidence. I was able to really see the very considerate and gentle side of these youths.
Whenever she helps me and she asks me for help, I feel very connected with her.
For the students, the willingness to try and also to interact with a different generation. Yeah, I think it's an eye-opening thing to them.
On the day of the showcase, I feel very nervous. At first, I didn't want to come.
I think Auntie Daisy called Iman and said, I understand why you're not here. It's okay. And Iman came.
1 minute before we go on stage.
Yeah. He was like, I am gonna come because my partner completely understands me and I didn't want to let her down. So I'm gonna put my own insecurities aside and show up for her.
And once when I came down, I expect everyone to like be disappointed in me. But to my surprise, everyone all like welcomed me, and the first one to saw me was Auntie Daisy, and she instantly hugged me.
I said, "Ayo, Aiman, I miss you, good boy."
I feel happy and I feel very successful.
I was proud that I could show what I could do.
I will show my grandchildren. You see, Mama, she performed there.
After the dance, my mother told me they are very proud. Yeah, I actually think I grew a lot in confidence also.
It is a great affirmation and encouragement that their family and their parents are there for them to really support them and to cheer them on.
Having this opportunity to come and see them present something on stage allows us to see them in a completely different light and who they can become moving forward.
Without Esplanade, the show won't go on. Thank you for supporting us throughout this dance project.
Thank you so much. I think I'm supposed to ask you a question, but I think the video speaks actually for itself. So I can only ask you what's next.
I was just about to add, I'm going to be at lunch. I mean, I'm very happy to work with. I think my greatest challenge is actually impact evaluation. A lot of my donors are increasingly asking me evidence-based impact. The video not enough, you know. So if anyone has any ideas, any suggestions, I'll be at lunch. I'm happy to speak with you and maybe connect with you.
I'm a terrible dancer, but I do impact evaluation. Also cost effectiveness analysis. So let us
I'll
have
catch
some.
up with you over lunch.
All right. Now pass back to Sharda, please.
Yes. Oh, thank you so much, everyone. Thank you to all our speakers. Thank you to Joanne. Thank you to everyone in the audience. You know, you all have my deep admiration for the work that all of you do. I know that all of you in the audience do such good work as well. It's been a very energized day, as much as it's also been very emotional. I think those videos have really pulled at my heartstrings this morning. But yes, thank you so much. We will be ending our session today, but we also have obviously our networking session downstairs, which we're all looking forward to. We also have a feedback form. Now, this survey form, which we're going to put on the screen now, really helps NAC to maintain engaging sessions for you. So if you please scan the QR code, thank you so much. Also, if you show your completed survey, you get a chocolate while stocks last. I'm not joking. You go downstairs to the booth, you show your survey, you get a chocolate, okay? Now things are very expensive, so a chocolate is always worth it. For those of you going for the slow arts excursion at the National Gallery, please gather at the entrance at by 1:30 p.m. because you will board the bus at 1:30 p.m. And for the rest of us, really looking forward for the networking session downstairs. It's always an opportunity to have meaningful conversations and create meaningful collaborations. Thank you for a spectacular morning into an afternoon, everyone. Take care and have a great time. Goodbye.